Whoa, that color saturation looking kind of weird. Looking kind of weird. I don't know why. No idea why. No idea why. Why, oh, why, oh, why. What's up? What's up, everybody? Today is Monday. I don't know. Today is Monday. Hope everybody had a good weekend. Welcome, welcome, welcome. It is 5:30 on the dot, Texas time. So we're just waiting for folks to jump up in here. See who all is going to jump in so we can have a little chit chat. See what's going on. About to see what's going on. See what's going on. See what's going. Y'all hear him already? Like, bro, I can't do nothing out here. I can't do nothing out here, bro. What's up? What's up? Welcome, welcome, welcome to the live stream, or welcome to the TikTok live. I call it live stream just because I don't know. I just want to be different. I don't know why it looks so bright up in here. I mean, I usually don't ever really complain about lighting, but I'm complaining about lighting today. Like, straight up. Complaining about lighting today. Don't know why. I got old man eyes. I don't know if y'all can see them, but I do. So that's what's going on. Shout out to all 15 of y'all that are up in here. Welcome to the live stream or the TikTok live. If y'all are new here, if you've never been over here before, my name is Kevin. I go by the Boot Nurse on all social media platforms. Today, and like always, we're going to be talking about nursing stuff, nursing news, NCLEX stuff. Essentially anything that you want to ask me, you guys can go ahead and ask me. We're going to talk about some things that have been happening in the nursing world, as well as we're going to go over some NCLEX style questions, because I know that's why all of you are here, coming over here to chit chat with me. If you guys have any questions at all, make sure you guys drop them down in the chat. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Are you doing NCLEX? Are you doing prerequisites? Are you a brand new nurse? Are you about to graduate? Like, let us know. Let us know down there in the comments. My co-host, Nurse Nelly, is in the chat. So if I don't get to any of your questions, she will surely do it. And I'm pretty sure my other co-host will jump up here. And when she does, I will introduce her as well. Nurse Nelly has been a nurse for a little over 4 years. She's worked in med-surg, tele, ICU, and now she does case management. Loving her life. I've been an OR. I'm an OR nurse. I also have ICU and PACU experience. Been a nurse for a little over about 3.5 years. And yeah, that's kind of where we are. So I want to know who you are, where you're from. Let me know what's up. Nurse Tammy said, found out this morning I passed my NCLEX. Shout out to you, Nurse Tammy. Welcome to the shit. Welcome to nursing. We appreciate you. Hey, all 118 of y'all or 17 of y'all need to give Nurse Tammy some love. Let her know what's going on. Let her know what's up. Welcome her to nursing. Welcome to the shit show. It's going to be great. You're going to love it. It's going to be glorious. So there is that. And make sure you guys smash that like button. Like, smash it, like, until there's like no existence, or until you start to get carpal tunnel in your fingers, like whatever you want to do. But make sure that's happening, right? Make sure you guys share this live stream as well. And to let other people know that, like, what we got going on. We're over here, talking about nursing stuff. We're over here trying to foster a really good environment of, constructive criticism. We don't need to be rude, but we can always critique one another, where we foster a really good conversation. So can you explain what it means to work for a union and what are the benefits? I don't know. I couldn't tell you because I'm not part of a union. I live in Texas. We don't have a union. So NCLEX RN, Cindy, what's up? Okay. Is it Gigi? I'm a new grad and I IMCU. Any advice? One thing I'll tell you is at Pink Obsessions. The one thing I'll tell you is to be a sponge. One YouTube channel I really recommend is ICU Advantage. You learn so many great things over there on that YouTube channel. As well as if you're uncomfortable, you need to say something. But then there is going to be that point in time where they are going to leave you to the wolves. But if you're uncomfortable with stuff, you need to open up your mouth and you need to say something. Any tips for giving report? You always start off with who your patient is, why they are there, and you start off with the most critical things that are going on with the patient. That would be my tip for when you're giving report. Tips on rounds. You give them the most important things. You let them know, like, hey, I have Mr. Jones here. Mr. Jones came to us for whatever X, Y, and Z reasons. You let them know their current vital signs. You let them know all the interventions and things that you have done. You let them know all the pertinent labs, so on and so forth. So only things of importance that you need to give during rounds, right? So you don't need to sit there and be like, yeah, I gave him a bed bath and, like, yeah, I did this. I was just like, although a bed bath is important or CHG baths or wipe downs are important, you need to give them the things that are pertinent, such as trending lab values, what's their respiratory rate looking like, so on and so forth. That is what is important when you give during rounds. Rounds can be very, very challenging, as well as rounds can be, they can be very intimidating because, especially if you're a young nurse and you don't know exactly like what to say, what to do, so on and so forth. But once you get it down, if you have a really good preceptor, they should be teaching people how to do that anyway. But once you get the rounds down of giving them of what's important, also giving your suggestion about what you think may be going on, because if you have a good doctor who's in charge of doing rounds, they usually are good about teaching you, giving you a little bit of making it a teaching moment to let you know what's going on. So looking for a good online RN school. Just got my LVN license 1 year ago. Any suggestions? Well, Juanita, I like to tell people to look at Western Governors University, but a quick Google search will tell you anything like that. I think Chamberlain is also online. Correct me if I'm wrong for anybody that may be going to Chamberlain. What does it say? Kelly says, depends on who you are giving a report to. I did. Yep. It depends on who you're giving a report to on the level of importance, right? And some doctors are just, some doctors are assholes and they just like, they don't care. They don't want to listen to you or whatever. You just got to understand that and take that for what it is. But then make sure you document, how rounds went, because, if something goes wrong and you try to tell somebody and they try to blame it on you, there it is. Matilda. This is Bob and Bill. I'm sorry. I couldn't help myself. Welcome, Matilda. I'm a radiology tech. Or is radiology tech or nursing better? I'm stuck. Depends on, Gabe, it depends on what you want to do and what you like. If you like radiology, then cool. If you like nursing, then cool too. You're not wrong for trying either one of them. You're not wrong for trying either one of them. You can actually be a nurse working in radiology. Like, a lot of people don't realize that either. So anytime you do anything with a patient, you should document it. Facts. Some nurses are intense. Others are chill, can intimidate you. Facts. I want to be a labor and delivery nurse. What does it say? Deanne. Okay. If you want to be a labor and delivery nurse, tell me how you are going to get there. I'm just saying. Gloria says, okay. Well, welcome to all 62 of you guys up in here, and gals, of course. If it's your first time on the stream or the TikTok live, my name is Kevin. Welcome to our nice little live stream we have going on here. I go by the Boot Nurse on all social media platforms. So check me out on Instagram, of course, over there on YouTube. And, of course, over here on TikTok, we do these lives Monday, Wednesday, Friday at 5:30 Central Standard Time, Texas time, because that's the only time that really matters. But I want to know who you are, where you're from, where you're at in your nursing journey. So are you taking NCLEX? Are you about to start school? Are you about to finish school? Are you a brand new nurse? Are you a nurse that has, years of experience? Like, what area do you, work in? We want to know all that. And if you're a brand new nurse and you would like to get a jump start on your NCLEX journey, right now, you can check out the 7-day NCLEX course. That course is for $48. The link is in my bio. And once you get it forever. We have content videos that are getting put up, as well as NCLEX style question videos that are going up, as well as NCLEX style questions that will be going up. So it's in its pre-launch phase, so it's being built. We are building the plane as we are flying, and that is exactly how we like to do things. So come over there and be an early adopter and be a part of the greatness and be a part of the growth. Like I said, that link is in the bio, 80% off. Make sure you guys check it out. Okay. Let me see what's going on here. Gloria says she's from Maryland. I'm currently in my prereq class. I'm passing those, but my thing is the studying part. I don't know what that means, Deanne. What do you mean? What support program do you recommend to study for the NCLEX? Depends. There's so many Ebony. There's so many really good reviews out there. I'm going to be biased and say that my review that I am currently working on is great, but it depends on how much time you have and how much time you really need. So, like I said, mine's in the prereq or the pre-launch phase, so it may not work for you. But they have other good ones out there. Like if you need questions, they got UWorld, they got Archer, they got Remar, they got Kaplan, they got Hearst. They got Mark Klimick. They got a lot of good ones out there. So it all just depends on you and what you want. I'm transferring nursing programs in Florida. Okay, shout out to you. Failed out of the LPN program, fixing to start again. Passed my T's yesterday. Shout out to you, Courtney, because we don't ever give up around here. Elisa said, I'm a certified surgical first assistant. Shout out to being a first assist. taking my prerequisites to enter nursing school. Shout out to you, Elisa. Is it Elisa or Alyssa? I'm going to say Elisa. I feel like that's what it is. Not a nurse, but I'm a CEO of Ladybug Travel Agency. Nice. Ladybug, is that like a travel agency, like just for leisure or for like nerd? Like, what is that for? A future labor delivery nurse here. Okay. Shout out to you. My joyful life. Jessica says Hirsch review. So here's the one thing I didn't like about the Hirsch review. I couldn't get over the accent. Like the accent was just a real distraction for me. And so as I was trying to learn, I couldn't really retain anything. So it just didn't really work for me. But statistically, it shows that, it works for people. Yeah. Like Miss, what's her name? She goes by Aunt Marlene. And then some of the other folks that are in there, they have really thick country accents. And it was a distraction for me. And so the Hearst review now is different from the Hearst review when I took it. Right. Yeah. So, okay, you're from the South and so am I. I'm from the South. But some things I just don't get. Right. Because I live in Texas. So it just didn't work out. It didn't work out that way. So like I said, like the review that I took with Hearst is different from the review that's there now because I know they have updated videos. So there's that. Oh, my God, Kevin. Hi. I hope all is well. Hey, what's up, girl? What's up? Let me see. I'm from the South. I have Kaplan. I have time. Okay, cool. Kaplan's a good one. I used Kaplan to pass my NCLEX. I used Kaplan and Mark Klimek audios. I thought it was great. I book family and group trips. I also do solo trips. Nice. Registered Nurse RN has a country accent. She has a country accent too. I listened to her a few times, but she's like, hey y'all, it's Nurse Sarah, Registered Nurse RN. I'm like, oh my God. I'm just like, look, I would still give her all my money because there's so many other things that were out there that worked for me. But while I was in nursing school, it worked well, but for NCLEX, not so much. So, Nurse, I like her for Fluid, right? She has a bunch of good stuff on her YouTube channel. She really, really does. Shout out to all 35 of y'all that are up in here. So y'all let me know where y'all are from. If you're new, let me know where you're from. What questions do you guys have? Hey, we're going to go over NCLEX style questions here shortly. But I like to kind of start some things off just to make sure like, hey, I'm here. What questions do you guys have? We got other folks that are on here. Shout out from California. Okay. Juanita. But we're also going to go over some nursing news, like some things so the one thing about being on here, if you guys don't know, is that I don't coddle people. I'm pretty honest, but I'm very understanding about like what people go through. And for those that are new here, when it comes to nursing school, I did okay in nursing school. I failed a lot of tests while I was in nursing school. I got through nursing school, graduated, did all that, took my NCLEX, and I failed 3 times, right? So why do I say that? Is because those things don't determine what type of nurse that you're going to be. What determines the type of nurse that you're going to be is only you and how you perform while you are taking care of your patients, while you're at a hospital, while you're in a clinic, while you're doing whatever. So that's the reason why I say that. It's just like people will fail a test and they'll quit. Don't quit. We don't want you to quit at all. Give us information about how to pass what? And how about we ask nicely? Give us information on how to pass TEAS tests. So if you want information on how to pass the TEAS test, my joyful life, I would recommend looking at the Mometrics yellow book, the Mometrics TEAS yellow book, which is you can buy off Amazon. You study that book for like a good month, read through it, do its questions, so on and so forth. You'll shatter the TEAS exam. You'll shatter it. My opinion, of course. I personally was studying for the TEAS for multiple schools that I applied for, and I studied for it, but I didn't. I never took the TEAS, but I studied for it. It was great. I thought it was a really good book. So, but I ended up taking the HESI when I was in school. Not a big fan of the HESI at all. So Quizlet YouTube helped me with the TEAS. I'm not really like YouTube. Yeah, but Quizlet, there's so many different things that are out there with Quizlet. And so many people can just go in there and answer and then change answers as much as they want. Me personally, I just wasn't a big fan of Quizlet, but YouTube helps extremely well. I would tell anybody to go to YouTube for anything. I have to take the HESI. So Mometrics makes a HESI book as well, the yellow book, Elisa. I had to take the HESI. I actually failed the HESI the first time. Like I got you needed like a 75 or whatever for them to like look at you or whatever. And I think I got like a 74 or 73. And then I turned around and I had the Mometrics book, but then I had the Trivium book, one that one of these girls gave me. had it all highlighted, all nice and pretty. I went through that book for like a month, shattered it. I failed into my program HESI in third semester. Look, so there it is. It's just like you don't have to be perfect. You just need to get through it. And we all fail. We all have those things that go on with us, right? So shout out to all. Man, we got 19 people up in here. That's a lot more than I thought. So like I said, once again, if you guys have any questions, comments, go ahead and drop them down in the what is that? The chat box, right? Usually we have some other co-hosts on here, but they're not here yet. So here's one thing I am going to talk about. I like to talk about nursing news and stuff like that. So a couple of things that came up was on the yesterday, an article got put up that the New York Supreme Court reinstates nurse who was fired for refusing the COVID vaccine. So a lot of people are asking like, hey, do I have to take the COVID vaccine to go work as a nurse? And the answer is no. My hospital doesn't require you to get your COVID vaccine. However, if you're a nursing student, those nursing programs, whatever they require, you're kind of at the mercy of whatever they require. What was the name of the book you used to pass? So it's like the Trivium. It's Trivium. Yeah, it's like a Trivium book, and it's like blue and green. I've been saying I was going to make a TikTok about it. That way everybody can see, but I just haven't because, your boy's been busy. So, but yeah, it's the Trivium book. And if you can't find that book, well, you should be able to find that book. It's like $28, $35 or something like that on Amazon. You can't miss it. It's like Trivium, the Trivium HESI book, something like that. Yeah, no problem. Have you tried ATI with the nursing program? Them proctors is tough, about 8 weeks away, then I'm done. No, I never had to take ATI. So my school did nothing but HESI. We didn't have to take ATI because ATI, I'm not even gonna lie to you. I've seen some ATI tests and I think that they're terrible. And same thing with HESI. I think they're terrible as well. But I think in my humble opinion, what I wish that people would have done or these schools would have done is they really hammer you with NCLEX style questions from the beginning. So if they hammer you with NCLEX style questions from the beginning, or at least after your first semester, like after fundamentals, I feel like that more people will be more prepared for NCLEX when that time comes. Yes, they require the vaccination because working with patients in the nursing home. Okay. I mean, it just depends because like I said, my hospital, they don't require you to do it. A lot of hospitals don't require you to get your COVID vaccine, but I do know that schools do. Some schools do, some schools don't, unless you have like a religious exemption or something along the lines of that. So, but yeah, so that happened right there with the Supreme Court, and that was in New York. And so a lot of hospitals are now that when they fired all these nurses for not getting the COVID vaccine, they're now been like, hey, come back, because if people don't realize is that we're in a nursing shortage, and we've always been in a nursing shortage. It's just now it's very more brought to light because of social media and because of COVID. So, those are those things to be aware of. Yeah, the schools, I was agreeing. Oh, okay, I got you. I'm tracking. Shout out to all 20 of y'all for hanging out with me. Welcome on this Monday. If this is your first time to the TikTok live, my name is Kevin. I go by the Boot Nurse on all social media platforms. You can follow me on Instagram, X, Thread. Why those two are even fighting like that, I don't even know. But of course, you can follow me on YouTube. And also, if you know anybody who needs this type of conversation, as in talking about nursing, talking about the field, talking about school, talking about NCLEX style questions, make sure you guys share it. All right. And make sure you guys smash that like button. I want 1,000 likes right now. Make it happen. I love you. So, yeah. So if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey, what questions you have. Have you taken the NCLEX? Have you passed? Have you not passed? Are you a pre-nursing student? Are you in school right now? Are you about to graduate? We like to give kudos and love to those, who like to come and hang out with us. So let us know who you are, where you're from. What else is going on? Oh, so there was another story that came out about an elderly nurse. She was 72 years old, y'all. 72 years old, got into an altercation with another nurse, and she was claiming self-defense, but they sent this 72-year-old nurse to jail, and she had to forfeit her license. So the article is crazy. I'm not going to read the whole article. If you guys want to read the article, it's on nurse.org. And if you go to the news section and then look at all articles, it'll pop up. It's like number 3. But yeah, so essentially she got fired from her job. She got assault charges put on her, and they put her in jail for like 6 months. And she's 72 years old and been a nurse for 40 years. So in my mind, make that make sense. Make that make sense. Man, this tease test busting what? Oh, I'm guessing you said a bad word in TikTok with like, nah, we can't do that. What kind of nurse do you do? I'm assuming you're asking me what kind of nurse am I? And I'm an OR nurse. I work in the operator room. Did we just start? No, we didn't. We actually started like 20 minutes ago. So you're 20 minutes late. But we're actually going to start. We're going to start going through some NCLEX style questions, kind of just doing some housekeeping, talking about some news and stuff in regards to, like what's going on. Nice. So you're a circulator. I actually can circulate and I can scrub because I'm actually a surgical tech as well. So I actually could be, I can scrub into OR cases if I so choose. But I don't choose to do so. So I'm kind of like over the I'm kind of over the scrubbing aspect of the operating room. But yeah, mostly a circulator for sure. So, but yeah, how do you guys, what's your guys' opinion on that? Like, according to the article, they said that she was disinfecting something. Some other nurse, I guess, assumed that they were spraying it in her face. And then that other nurse pushed her. They got into an altercation. And like I said, this lady's 72 years old. So the first thing she grabbed was like the can or some bottle and smashed that lady over the head with it. So, I mean, gotta be safe out here. I'm just keeping it real. So, but yeah. So that's another thing that's going on in the nursing world in regards to that. Of course, if you live in the state of Oregon, there's a nursing staff ratio going on as well in Oregon to where they actually have safer nursing ratios in the state of Oregon, which is why I don't understand why we have these rules and a lot of people don't abide by them. So I'm over nurses being in the news. I just don't discuss these stories. Okay, cool. You don't have to discuss these stories, but I think it's important that we know these stories. Okay? Like, you may not like it, but it's still in the news. I don't like the stories because I don't like the stories. They could be kind of disheartening. You're just like, bro, like, what's going on here? You know what I mean? And the thing about it is, like, you most definitely can learn from them. We can learn. Yeah, exactly. You can learn from all this shit that's happening, in these things. Like, so, for example, like there was another article that came out where it says nurse police teams impact significant pilot program. So essentially, you could actually be a nurse that goes out with a police officer. If this is something that you want to do, you can go out with a police officer and essentially be one of the first responders right there on scene in case something happens. So if the police officer gets shot, boom, you're there. If they need for you to resuscitate a victim or if a victim gets shot, boom, you're already there. Now, is it high speed and is it dangerous? Absolutely. But if that's your cup of tea and if that's how you want to contribute to society, that's there as well. You can, but I feel like they're trying to bring nurses down. They're always trying to bring nurses down. It's the media. The media does what the media does, which is, divide us as everything, as well as, put us against one another. But, those things like these things need to be put out here so we can actually foster a good conversation about what not to do for ourselves, and how we can do better, So like I said, like with the elderly lady, like I don't even like the way, like that's the one thing when I saw this article, I didn't even like the way that the headline was put. It says elderly nurse gets jail time for assault on coworker, claims self-defense. I'm not going to say like, hey, elderly woman goes to jail on accident. Like that's not going to get people to click on it. It's not going to get people to read. So they know exactly what they're doing by making the headline the way that it is, because it gets people there. So, and then of course, like we're talking about the staff ratios, but yeah, that one specifically about being a nurse police officer or being part of the nurse police team. Hey, if that's something that you're interested in, that opportunity is there. It's a pilot course. I can't remember exactly where it's at. I feel like I want to say Ohio, but I don't know. I ain't never been to Ohio, so there's that. Yeah, definitely something that we can learn from. It says starting a new grad on night shift is dangerous. No educator or manager shaking my head. I agree. Landon, I 100% agree. I don't believe that any new grad should ever, 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 ever have to go to night shift. But then again, you have the people that are on the day shift that have been nurses for a while that don't want to give that up. And the crappy part is that you don't have anybody on night. Like, it'd be different if it was a standard where you put people that were on nights, but then you got people that are just like, nope, new grads go to nights, which is the worst thing. Like me, I was a new grad and I got put on nights, and it was terrible because like I went through, all of this during COVID, and it was shitty. Like, it was really shitty. Like, I'm telling you, it was bad. But, like at this point, I'm just like, I'm sticking up for myself, but she's not hearing me. And then when I tell her I'm done, all of a sudden, then you want to hear me. You know what I'm saying? Do you aspire to get your master's? I do. I do, but I don't, because I just don't want to go back to school. And I'm tired of people telling me you need to go back to school. I don't need to do nothing. That's number one. Number two, if I want to go back to school, I have that opportunity to do so. And so I've really been weighing on it. I've been weighing on it. Trust and believe me. So, but, I do aspire to get my master's, and that's really been apparent for the last few months. That I was like, you know what, maybe I should go back and get my master's. So, what will you get your master's in? It'll be in nurse education, because I have an education background. I've been an instructor since 2015. I'm a master instructor in the Navy, and I've been teaching, for the last 8 years. And then once I became a nurse, it just made it to where I could just start to teach that aspect. And I love teaching, especially like nursing students that are in clinicals. So nurse education is the direction for me. I hear so many people say, well, there's no money in that. There's no money in that for you. But me, baby, I don't know I'm sorry. I don't know what that means. Anyways, but yeah, that's my direction, and that's where I'm going. I just got offered an L&D position on nights as a new grad. What does it say? Anything could go wrong. That's facts. Anything can go wrong. Anything can go wrong. I mean, anything can go wrong on days too. But the great thing about days is that you have all the support that you could ever need while you're on days. And you might as well just cut that shit in half when you go to nights. You'd be a phenomenal nurse educator. I appreciate that. Because let me tell you, some of these nurse educators that I see, they're fucking trash. Sorry. Hey, if you don't like my language, I apologize. It comes with the territory. It comes with me and with my territory. But nurses got some potty mouths. I'm just saying, not just me. I'm just keeping it real. Oh, and then a lot of this likes to come out. So I'm just keeping it all the way real. So shout out to all y'all that are hanging out in here. But nurse education is definitely where I want to go. And especially, I don't have to be a nurse educator working in a hospital to educate other nurses. I can educate other nurses based off of when I see them in the hospital, and I'm not directly doing that because regardless, all of us as nurses are teachers, right? And plus, I educate with 7-day NCLEX course, which is in this pre-launch phase that you guys can find in my bio, $48. Go check it out. See that plug I did there? Sometimes I love myself, but I'm just saying. But no, but yeah, so I love teaching, and I never thought I would be that person that would love teaching, but I absolutely love it. In college, I had a professor who tried to memorize her notes and would stumble over her material. So the thing about it is, like, once you start to teach things, after a while, you use your PowerPoints or you use your whatever you have, you use them as references, and then you start talking. So my biggest thing is that I'll start talking and I'll start going off on tangents. I'll be like, oops, my bad. Let me back up. So. What does it say? It says, Landon says, oh no, love, that wasn't to you. It was to Kevin when he said, oh, my bad. Yeah, Tia, my bad. That was for me. I got you. Could you mentor me one-on-one? I could, Brandon, mentor you one-on-one, and you're a repeat test taker. So you can go to my website, thebootnurse.com, and then you go to NCLEX Coaching and Mentoring, and that's how I do my coaching and my mentoring one-on-one. So if you want to check that out, sir, you surely can. Never thought about night shift for new grads being detrimental. Something to think about for sure. Yeah, I'm dead serious. Like I try to tell all new graduate nurses, don't go to nights if you can't help it. Don't go to nights at all, and go to a level 1 trauma facility. If you like, those are one of the two biggest things that I always try to give to brand new nurses, as in like, hey, go to a level 1 trauma facility because you're going to have everybody and everything that you could possibly want. You're going to have more people than you would have if you went to a level 3 or so on and so forth. And go to days, because when you go to nights, like, you have a lot of autonomy. You have a lot of responsibility that you don't even know. I'll give you a prime example.
of a story that I heard today. A patient had an INR of 8, above 8. Who can tell me what that means? Who can tell me what that means? Shout out to you, Tia, for giving me roses. Girl, I see you. I appreciate you. Right? So an INR of 8, what does that mean? For my seasoned nurses, I don't want you answering. Yeah, blood way too thin. I don't know. Vitamin K liver issue. Yep. Bleeding out, right? So the example I was just like, I was like an INR above 8. I'm like, holy shit. I was like, that fool's probably, like, he sneezed wrong. He's going to blow the back of his brains out. Or, you know, he could be bleeding from every hole like somebody that got Ebola. You know what I'm saying? So when I was just like, okay, the INR is 8. So the provider put in, you know, a typing screen and FFP. Makes sense, right? So typing screen, FMP, nurse, brand new nurse, 9 times out of 10 hasn't been shown this procedure at all, acknowledges the labs that the provider put in at 11 p.m., right? So 11 p.m. at night. And then we go to 7 a.m. the next day, right? We go to 7 a.m. the next day. Guess what labs haven't been drawn? No typing screen, aka no FMP given, right? So, of course, providers pissed the hell off. As in, like, yo, I put this order in at 11 p.m. You acknowledged it at 11:15, 11:20, and it is 7 a.m. and that person did not draw this lab, right? Luckily, no issue with the patient, right? Luckily, no issue with the patient. However, providers just like, I went to the director, I did this, I did that. I'm like, all right, cool. So you did this and you did that. And now me being the protective individual of a new grad or new people, I'm just like, you know how I feel about that, because we have no idea what this person was taught, and I have no idea how long they've been on nights. I have no idea what their experience is, or how they were teaching. How was orientation, you know? But then it was all this back and forth and just like that. And I understood, because I could see both sides. Patient would have died. Oh, that would have been a brand new nurse who probably would have been a nurse for 3 or 4 months, already on nights and probably asking for help, or probably afraid to ask for help because of whatever nonsense is going on. Didn't do that. Like, didn't draw the labs, you know, didn't get that typing screen done so they can get FFP. You know what I mean? So, that's one of those things that I don't like about new grads going to nights. It's because sometimes the basics of what you need, you have to get at days. And then when they do keep you on days, they only keep you on days for like, what, a couple of weeks, and then boom, the rest of the time you're at night. Come on, make that make sense. How do you do one-on-one? I don't know what you mean, user 55. I'm gonna need for you to give me a little bit more context. Landon said all the BS happens on nights. I don't know how much they offer. They even offer 10K bonus. Yeah, so they would offer people that would like a $10,000 bonus, and you owe, it's like a 2-year obligation to the hospitals. You know, I'm just like, bro, like that money ain't, no. And if you decide that you want to take that money, and then let's say you take it and then you leave 3 or 4 months afterwards, you know, you got to pay them that money back. So, you said, user 55 says, sorry, one-on-one tutoring. Oh, okay. If you want one-on-one tutoring, go to thebootnurse.com and click on the tab that says, NCLEX Coaching and Mentoring. And there, that's where it's at. That's how you do one-on-one coaching with me, or one-on-one tutoring with me. So shout out to all 28 of y'all in here. If you guys are new here, welcome to the TikTok Live. My name is Kevin. I go by The Boot Nurse on all social media platforms. Make sure you guys check it out. YouTube, X, gonna give it to you. Thread, Instagram, because I'm always on Instagram, doing some on Instagram. I got a Facebook group, The Boot Nation. Go check it out. Come be a part of The Boot Nation, right? And, you know, for those that want to know what The Boot Nation stands for and The Boot Nurse stands for, I essentially don't like being called a baby nurse. I feel like that's kind of weird. I'm a grown man. Do I look like a baby to you? Okay. Anyways, so, And it's a cross between military terms. So we call brand new people that come into the military boots. And so I consider myself a boot in every aspect of me doing anything. And when I became a nurse, I was a boot nurse. So I was like, I don't know nothing about nothing, and I'm consistently learning all day, every day, all the time. So that's how the boot nurse was established. It was established in 2020 when I became a nurse. And the Boot Nation are other nurses that are boots. Because it doesn't matter if you have 40 years of experience or if you have 6 months of experience. We're all consistently learning stuff every day. And that's where my thought process came from that. Oh, and then of course, I'm in the military. I've been in the Navy for 16 years, and I wear boots. One day I'm just gonna bring my dirty ass boots in here. I'm gonna be like, hey guys, look. So this is another example of a boot nurse, me. So there's that. It says, despite floating, I would be so stressed. Look, I've been floated, but I've only been floated between other ICUs when I worked in the ICU. So, and I mean, that was stressful, but then again, it wasn't stressful, but I got you. I see your hook 'em, but what about wreck 'em? Hey, don't do that. Don't do that. Jonah, don't do that. Don't do that. You about to get banned for such language, okay? I'm just saying. I'm just playing. Shout out to you. But shout out to all y'all that are hanging out here. Hey, but I want to know who you are, where you're from, where you're at in your nursing journey. Are you a brand new nurse? You taking your NCLEX? Failed NCLEX? Are you a brand new nursing student? Like, let's talk. We're going to foster a really good conversation. We got my co-host, Nurse Nelly, that's down there, that has been a nurse for 4 years. She's worked in med-surg, worked in tele, ICU, now does case management, loving her life. So she'll straight up, let you know how it is. And that's the thing is, like, I ain't going to sit here. I ain't going to lie to you. I'm not going to be like, oh my God, the hospital's great, blah, blah, blah. Look, all right. I'm going to keep it all the way real, letting y'all know what's up. I thought the boot nurse meant you were from NO. Hey, I see. Okay. Not that boot. Not that boot. I had to think about that. I was like, from the NO? No. Rose, not that boot. That would work out pretty good for if I was from there. So, future psych nurse, that's what I'm talking about. We speak that stuff into existence, Love these lives though. I've learned a lot. Appreciate you doing this for sure. I enjoy doing this. Are we doing NCLEX style questions tonight? Hospice, Sandy. We are. Look, I got them. See, all right. So here's the deal. Y'all got me to 3,000 followers, right? And not only were they 3,000 followers, but now when I try to stream on the TikTok studio, now it's telling me I need 10,000 followers. And I'm just like, bro, seriously? Right? So they want to play this game with me. So now I need 10,000 followers. I need all of y'all to share, and I need all of y'all to like me. I need all 23 of y'all. If y'all don't follow me, I need for y'all to follow me now. And then I need for you to follow me some more. And then I need you to tell other people to follow me just because you like me. And I'm an awesome dude. Come on, y'all. Stop playing these games with me, all right? Let me see what's going on. The real Slim Shady? I bet you are not the real Slim Shady. Because if you were, you would not want to be coming up here asking about being a nurse, sir or ma'am, or whatever you identify as, okay? But so the NGN style questions. So here's the thing. Let me explain what the new generation NCLEX actually means before I go on. So the new generation NCLEX style questions essentially consist of like fill in the blank drop downs. They consist of case studies, and they also consist of like extended multiple responses, right? Now, that does not mean that the multiple choice, that the select all that apply, that the click and drag, that the put things in order, that does not mean that those have gone away, right? The next generation NCLEX just means that they have expanded on how they deliver the material to you. Now, the questions that I went over, and this is specifically towards the real Slim Shady since you asked this question, specifically we're doing select all that apply and multiple choice questions. Now, this is what I tell people, if you've been studying, it doesn't matter what format I put a question in, right? So if you understand the content, like when we go over diabetes, or we'll use DKA. If you understand the concept of what DKA is and what it looks like, they're dehydrated, they have a high glucose level, they have a high potassium level, I treat it with regular insulin, fluid, K-exalate, stuff like that. If you understand the content, it doesn't matter what format of the question I put it in, you should still be able to get it right. Right? Now, to caveat that, these are not next generation NCLEX style question format. They're just select all that apply and some multiple choice. But you can still get some really great knowledge out of that, okay? LPN had a hard time passing entrance exam, only 3 classes away from my RN, though. Shout out to you. Is that Aaron? Aaron? I can't really call you that because your name's not Aaron. From Chicago, repeat test taker, and trying to find out what nursing area is my true passion. Hey, that'll take you some time. You'll never know. I am, bro. I got you. Got you. Sir, I got you. All right, cool. I think I do, but the minute I read NCLEX, I blank out. Okay. I wish there was a grandfather. Oh, I wish there was a grandfather in way to get your RN if you already have your LPN. See now, Aaron, here's what I'll tell you. Me, and I'll say this, hindsight's 2020, is that man, now you just made me lose my train of thought. It'll come back to me. But you're saying that you wish that there was a grandfather, as in like you're talking about if you're already an LPN to take the old generation NCLEX. Is that what you're saying? Do you do self-performance report evaluation? Are you talking about, hold on. I think I know what you're talking about. Hold on. I think I know what you're talking about. Are you talking about, I'm just going to pull this one off. Hey, all right, so Brandon, are you talking about this report? You talking about this one? That tells you if you're below passing, near passing, so on and so forth. Is that what we're talking about? I know you're not in peds, but can I request some peds questions in future lives? Yes, you can. As a matter of fact, I'll write it down right now. All right, I will write it down right now just because you asked me, right? So peds questions, NCLEX style. Done. Got it. All right. So it says, question, do all schools have a white coat ceremony? I think so. I'm pretty sure they do. Let's see. Man, what are y'all doing? Y'all are giving me all kinds of stuff up here. I don't know what's happening. Just a way to not take an entrance exam to get your, okay, I agree with that one. Aaron. I don't understand. I honestly don't understand why. Honestly, I think it's to me, shit like that is a racket. And I never understood why they do shit like that. But it's always been a racket to me. Okay, Brandon. Yeah. So let me see something. So where did I put it? I put it somewhere. Here we go. So this was which one was this one? This was my first one, I think. No, this was my second one that I took. Right? And it says near passing, below passing, near, below. Or near. I had 2 below the passing and like the rest of them were near, right? And so that was my second one that I took. That was the second one that I took, right? And so if you're asking in regards to tutoring, do I ask you for that? I do ask you for that, if that's what you're asking. Aaron says, amen. Ours was a pinning ceremony. Yep. Is UWorld still the best way to prep? I'm just going to call you Slim. Me, Slim, I did not like UWorld. However, here's the thing about UWorld, and not just UWorld, but any place where you decide to just buy questions and answers, right? Questions and answers that come with rationales. Now, the one thing I'll say to you is like, do you have a good understanding of content, right? And you got to think UWorld was more on the expensive side because people have been, they rant and rave about UWorld. And so UWorld, I want to say for like 6 months or for 3 months, it's like $200 or $300, something like that. Somebody correct me if I'm wrong. You guys can let me know down in the chat. But they're pretty expensive. The one thing I didn't like about UWorld is that they didn't give content. And I realized that I had a content deficit, meaning I wasn't able to retain the content in order to apply it to NCLEX style questions. 1, I had been out of school for a while, and 2, it's just I couldn't comprehend it. For some, I couldn't do it. And then when I go and take my exam, even though I was doing well on the questions, it was just like, do I truly know what this question is asking me? No, because I don't have any content in my fucking brain to back it up. Right? So UWorld is an option to prep. it may not be the best option for you. And it was not for me. On a penny story, amen. You had to work as an LVN approximately 6 to 7 years to test out for an RN. Rose, what are you talking about? What you mean? Would you suggest studying questions or study material and then practice questions for the NCLEX? My recommendation, and this is if you want me to tell you how I did it, user 73, I would say study content like for a little bit, like for like a couple of hours, like 2 or 3 hours, and then do 85 to 150 questions. Review your questions right at, like give yourself like a 30-minute break, review your questions and answers, the right and the wrong ones, and then call it a day, right? So you should be doing content, NCLEX style questions, reviewing all like every day or every other day. And then I actually modified it for myself to where I would do content on one day, and then I would do then it was 75 to 150 questions. And then I would do that every other day. I would give myself 1 day off, 1 to 2 days off, no more than 2. I recreated the testing center. So all my people that were unsuccessful taking the NCLEX, you can recreate the testing center. You already know what it looked like. Don't act like you don't know what it looked like. You already been there. So no phone, no drinks. I got a drink right here. No candy, no food, no nothing. Put your phone away, out of the room. Practice the environment that you're preparing for. Okay. Let's see. Brandon said, I had 2 low, all near, and 4 above. Oh, Brandon, you were almost there. You were almost there. Now, here's my question. What are the 2 that you got below in? Because the 2 that so the top 3 for NCLEX RN is management of care, physiological adaptation, and pharmacology. So if you did really bad in any of those 2 areas, that possibly could be a reason why you didn't pass. I don't know where to start. This will be my 4th attempt. That's cool. For all 25 of y'all who know my story or who don't know my story, I failed my NCLEX 3 times and I passed on the 4th. So Brandon, you don't know where to start. I can tell you right now, you know where to start. You want to know why? Because you started here, and you got other people that are in here that can help guide you in that right direction, right? So I'm going to ask you, Brandon, is tell me about your time management. Tell me about your life. Tell me about, do you understand content? Do you understand content to apply it to NCLEX style questions? Do you truly know what the question is asking you? Do you know how to eliminate questions? Do you know those key trigger words? Do you have any accountability? Like, what have you done and what haven't you done? Like when I do one-on-one coaching, I get real intrusive, not intrusive to the point to where it's, disrespectful to you as a person. But if you're asked, this exam is not just about passing. I don't even like saying the word pass. You conquer this exam because it's a journey. It's a journey from you to get there. From the moment that you said, I wanted to be a nurse, to the time that you pass or you conquer your exam and you are a registered nurse or an LVN or an LPN. I'm sorry. So whatever. Kev, we learn just the same. I'm saying that's how we do. How about ATI? What about ATI? What about ATI, Slim? What do you think about the online self-paced degree? Online self-paced degree, Aaron, for what? Okay, thanks. You're welcome. Basic care. Okay, so basic care was 1. In California, you could sit for the board to become an RN after working in California. 6 to 7 years. Okay, got you. Is it beneficial to review your performance even though each exam is different? Yes. Because even though the exams are different, they're still those are your areas that you need to bring up. Even though the exam's going to be different, but they can still pull from those areas, the caliber. So here's the thing, is that if you don't know if you don't know where to improve, if you fail it again, you're 9 times out of 10, you're going to have the same spot that you did rough in. So it only makes sense for you to not only, study everything else that you need to study, but, spend an extra 30 minutes to an hour on those areas that you didn't do so well in based off of your performance report. My 2 below, let's see. My 2 below were health promotions and maintenance and analyze cues. Well, that, sir, is different. Sorry, basic care. Basic care and comfort was near. Okay. Do you do NCLEX review for RN? Who said that? Is this a Limo Tala from Kenya? I do. I can do. So I have an NCLEX review that's in its pre-launch phase right now, which means it is consistently being updated. If you want to, that link is in my bio. You can go over there and check that out. It's going for $48 right now. Once you get it forever. So I actually uploaded about 3 or 4 videos this past week. And I'm working on getting about another 3 to 5 videos up there this week. And I've been listening to everybody and I hear everything that you guys are saying. So in production right now, I haven't even told this to everybody that's in the yet. That's in the course. But I'm doing, a review based off of the 8 sections of the NCLEX pie, and I'm doing questions for the next generation. So I'm doing questions. It's going to be in PowerPoint form. It's going to be within the review itself. So that's coming. But remember, I'm a one-man army. There's only so many things that I could do at once. But I promise you, I hear everything that everybody is saying, and we are pushing and we are making it work. So especially for those new nurses that are starting nursing school, it's perfect for you. $48 for you to get a review that you can use 2 years from now or a year from now. Come on, stop playing with me. I'm just saying, smash that like button. Hey, share it. Hey, I need 10 shares. Make it happen. 10 shares. I appreciate y'all. Let's see what else is going on. Okay, thanks. You're welcome. Brandon, is it like, what is the cost for your tutoring? So go over to the cost for my tutoring. The cost for my tutoring one-on-one is on thebootnurse.com. Click click the NCLEX mentoring and tutoring, and that is where you can find out about my tutoring. I'm actually also working on group coaching. I'm first going to start off with 5 students, and you're going to get essentially me. And look, I got a whole bunch of stuff lined up for people. So I'm just letting y'all know it's coming. So what did Jason say? Jason said something. I don't know what he said. Everybody's ranting and raving about what Jason said. Anyway, shout out to all 26 of y'all up in here. Congratulations to all of your new journey. Good luck to all the upcoming testers. I'm out. I'll catch you. Okay. I appreciate you, Tia, for stopping by. I appreciate the roses too, girls. What I'm talking about. So I hope you have a good rest of your day. Hey, remember, we're streaming, on Wednesday, 5:30. Don't miss it. Don't miss it. But anyway, so shout out to all of y'all. What else we got? What other questions you guys got? I think, and there's one other thing that I want to say for all those that are striving to be nurse practitioners. It says nurse practitioner is the fastest growing profession and has a 10-year prediction, meaning that the nurse practitioner is going to grow hugely. So any of those that are looking to, work independently or start up their own practices and all that good stuff, hey, nurse practitioner is the way to go. If you want the ultimate autonomy as a nurse, that is one of them. Like my son, his provider is a nurse practitioner, and she's great. She's great with him, right? I wouldn't have it any other way. So if you're that person that's looking to go the nurse practitioner route, that is there for you. All right, cool. So I think I ran my mouth enough. We talked about enough. Who's ready for some NCLEX style questions? Who's ready? Who's ready? Who's ready? I'm pretty sure hospice is hiding over there saying like me. Yep, there it is. There it is. All right, cool. There we go. All right, cool. Here we go. All right, so check this out. So I'm going to keep it like this, right? I'm going to keep it vertically, right? But I'm going to back it up some. That way you guys can see, so it's not all, that way it's not all over the place. All right, so give me 1 second. Y'all hang in there with me. All right, cool. I think this will work. All right, let's see. Because, apparently TikTok doesn't want me to be great. So I just got to, improvise. All right, not all up in my nose because don't nobody want all that. Let's see. I just like my stuff. All right, cool. Here we go. Let's flip the camera. All right, cool. Yeah, I got it right on the first time. Nice. All right, let's see what we got. How's everybody feel about that? We good? Y'all good out here? Give me a thumbs up. We good? Kev, don't play with the answers. Look, first of all, don't tell me how to live my life, okay? Don't tell me how to live my life. We good? All right. Look, AC baby over here telling me what to do. All right, I don't like that. That's all good. All right, I ain't gonna play with the answers much. Rose said I'm out. It's just I'm just a noisy LVN that stopped by. Stop. You ain't just a noisy LVN. You're an LVN, and you're important. You are important to be out here. Trust and believe me. If nobody ever tells you that, you are important. You know the answer? Cool. I'm glad you know the answer, but I'm about to ask it right now. All right, cool. Here we go. The clinical instructor directed the nurse student to care for a client with a potassium of 6.7, right? Paint the picture. Paint the picture. Which intervention is delegated correctly to the student? Is it A, give potassium? Give potassium 10 milliequivalents orally. Give K-exolate 15 milligrams orally. Give spirolactone 25 milligrams orally. Or assess the EKG strip for tall T waves. Jonah says D. Assess before intervene, says Brandon. Alex says D. Alex says D. Students can't give meds. That's not true. Alone anyway. What? ABC look familiar. Action, right? Shay says D. Okay. What else we got? Now let's go back to the question, right? We're gonna break it down. All right. So the clinical instructor directed the student nurse to care for a client whose potassium is 6.7. All right. Now, what are the normal ranges for potassium? What are the normal ranges for potassium? 3.5 to 5.0. Or you'll see there are some, exactly, Shay says 3.5 to 5.3. Now, here's one thing I will say is that on NCLEX, that 3.5 to 5.0 is a generalization, right? It's a generalization. Now, the NCLEX will not throw out questions that are going to be like, hey, you have a patient who has a potassium of 5.1. That's too close. It's too close for comfort, right? So now I obviously know that is way out of range, right? So what would be the thing that I would need to do to bring that down? Right? So think about those things. Like, which intervention is delegated correctly to the student nurse? We got B. B. Right. We got B. What else we got? Man, I hope the answer's B. Because everybody putting B. What else we got? Everybody saying B? K-exolate. Look at you. K-exolate will lower the K. It sure will. What else? What else we got? K-exolate. Okay, what else we got? Shout out to all 40 of y'all that are in here hanging out. We're over here going over NCLEX style questions. You can also give albuterol treatment or regular insulin with glucose. You sure can, but that ain't the answer. That ain't the answer choices, madam. You know that. As someone in IT, I'm going with B to be right. Okay. Really, guy? Really? All right. So I think we have a general consensus. We have some people saying B. We got some people saying D. Let us see what the answer is. We ready? Here we go. And 3, 2, 1. Oh, it is B. It is B because somebody said that it is K. So K-exolate. You could also translate that to K exits late or K exits, right? It's a really good way to think about it. So let's read it. It says delegation supervision. The normal range for potassium is 3.5 to 5.0. The client's potassium level is high. K-exolate eliminates potassium from the body through the gastrointestinal system. The right person must be assigned to the right task and jobs under the right circumstances. The nurse who assigns the tasks and jobs must then communicate with and direct the person during the task or job, right? 73, shout out to you. You got it. Well, automatically no to A if you do possess limitations. Okay, so we're going to go back up. So obviously A is obviously out because why would I give potassium to somebody who already has a high potassium, right? So that one's already gone, right? We already said that it's K-exolate, right? Because K-exolate, it pushes K out through the GI tracts or through the GI system, right? Now, there's no need to assess the EKG. It's because I know with a high potassium rate, I'm going to have a crazy EKG. There's no need to assess because you already have it. You already have an outer range, and it's asking you which one do you delegate. So essentially, this is an extra step rather than I already know what the lab is. I could just go ahead and give it. right? And so why not spironolactone or spironolactone? Why not this? Obviously, I don't know how to spell. Or I don't know how to talk. I don't know how to talk either, apparently. So why not C? Right? Because it's K sparing, right? It's not a K wasting. So that means if I give this, it's just gonna give me more potassium. It's gonna make my potassium go up. Right? So shout out to y'all. Shout out to everybody that picked B. I didn't know what the answer was. I'm just saying. I'm just showing you guys how to break the question down. I'm just joking. I knew what the question was. And I knew what the answers were. Everybody cool with that one? Can I go on to the next one? Sweet. We're going on to the next one. B. Ma'am, you're late. You are late. And yes, the answer was B. All right, so here we are. The patient with COPD has a nursing diagnosis of ineffective breathing patterns. Which is an appropriate action to delegate to the experienced LPN under your supervision? So now here's a question for my LPNs, right? This also could be worded to like what actions can a LPN accept from an RN, right? I worked in renal med surg. This stuff is like second language to me. Oh, okay, I got you. You got it? Okay, yeah. Nurse Nelly, if you got it, you can go ahead and answer it. All right, so first answer, observe how well the patient performs pursed lip breathing. B, plan a nursing regimen that gradually increases activity and tolerance. C, assist the patient with basic activities of daily living. Or D, consult with physical therapy department about reconditioning exercises. Waiting for our friends. I got you. Jao says C. Hospice nurse Sandy says C. Alex says C. Alex says C. What else we got? What else we got over here? I'm going to say Limo says A. Brandon says C. C is a CNA job. Look at you, Brandon. Okay. I like how you said that. That's a Steph. Steph says A. Tiffany says A. Nurse Nelly says C. User 21 says A. Does that say toke my jewel? Really? Says A. This fucking guy. TF says it wouldn't be A because that's considered an assessment. What else we got? That could possibly be true, TF. The fuck? You might be right. But you might be wrong. But this is why we do these things. This is why we do them. Let's see. How are we feeling about that? Can I go on to the can we go on to the answer? I think we have a general consensus. We have some people that say C, some people that say A. Not sure. Probably. So listen to me. A good decision now is better than a great decision later. Because you never know what's going to come upon that. All right. So let us know. All right. So here we go in 3, 2, 1. Oh, look at that. Observe how well the patient performs pursed lip breathing. Right. All right. We're going to read the explanation. Right. And you're right. The question is about breathing. Right. So it says experienced LPNs, LVNs can use observation of patients to gather data regarding how well patients perform interventions that have already been taught. It says the scope of practice for the licensed practical or vocational nurse will most likely include the legal ability of this nurse to perform data collection, plan, implement, and evaluate care under the direct supervision and guidance of the registered nurse. So it says observe. It does not say teach. It does not say educate. It does not say evaluate the first or anything like that. It says observe. Observe was the key term. Exactly. Observe was the key term. So we'll go back here, right? So we're gonna paint our picture. So the patient with COPD has a nursing diagnosis of ineffective breathing patterns. Cool. So we know that somebody with COPD doesn't have really good oxygen exchange. Cool. We understand that. Which is the appropriate action to delegate to an experienced LPN? under your supervision as an RN, right? So let's just say you don't know. You're just like, man, I read this question twice and I don't know. Let's go down to the answers. Maybe the answers can help it stick out, right? So observe how well the patient performs pursed lip breathing. Okay, does that work with somebody who has COPD? Yes. Does that work for somebody who's been diagnosed with ineffective breathing patterns? Yes, we'll hold on to that. Now, plan a nursing. Now this is where I messed up. When I was learning, I would see the word plan and then I would stop. But don't get into that habit. Read the whole thing, even if you know what's wrong. Read the whole thing, okay? Plan a nursing care regimen that gradually increases activity tolerance. LPNs do not plan. RNs do, right? Assist the patient with basic activities of daily living. Like Brandon just said, C is for CNAs. That is what a CNA or a UAP or a unlicensed assistive personnel, right? And then it says consult with the physical therapy department about reconditioning exercises. That's what an RN does. I think we all get the general understanding of that. We all understand that? I think we're good. I think we're Gucci. We got thumbs up. All right. We'll go on to the next one. Hey, how we feeling? How we feeling over there? We good? Shout out to all 48 of y'all over here. If you guys are new, welcome to the TikTok Live. My name is Kevin. I go by the Boot Nurse on all social media platforms. Right now, we're doing NCLEX style questions, but I want to know who you are, where you're from, and where you're at in your nursing journey. And go ahead and drop those down in the comments. And I'm pretty sure everyone will not have an issue answering those questions for you. Also, participate. Ask your questions, and we'll keep it moving. All right, let's check out this next question. When assessing a 22-year-old patient who required emergency surgery and multiple effusions 3 days ago, you find the patient looks anxious and has labored respirations at the rate of 38 breaths per minute. The oxygen saturation is 90% with the oxygen delivery at 6 liters per minute via nasal cannula. Which action is most appropriate? Increase the flow rate of oxygen to 10 liters per minute and reassess the patient after about 10 minutes. Assist the patient in using the incentive spirometer and splint his chest with a pillow while he coughs. Administer the ordered morphine sulfate to the patient to decrease his anxiety and reduce the hyperventilation. Or D, switch the patient to non-rebreather at 95% to 100% oxygen and call the physician to discuss the patient's status. I see D. Leslie says A, fusions. Like fusion, like what you mean, like Dragon Ball Z, like fusion? Is that what you're talking about? As long as we learn from, yep, that's right, got it, yes. D, Jewel, I'm just going to say Jewel. I'm not going to say your whole name. That is out of pocket. Says A, got D, nasal cannula can only go to 6 liters. That's true. Tipsy says C. Is that Tiana, like from The Princess and the Frog? She says D. Hair by 3T says D. Which would you do first? So which action is most appropriate? AKA, what would you do first? Like, look at your vital signs. Remember, so they're giving you a lot of stuff in this question, right? So here, to paint the backstory, they had an emergency surgery and multiple transfusions 3 days ago, right? You find that the patient looks anxious and has labored respirations, 38 per minute. What is the normal range, right? The oxygen saturation is at 90. What is the optimal level of O2 saturation that we want our patient to be at? Even though they're getting oxygen at 6 liters. So obviously this isn't working. So what would be our answer for that? Say D. PE, Jessica, we are not talking about pulmonary emblems, ma'am. We are not doing that. But I do like where your head's at. I do like it. Emergency, yep, because you can do 2 actions. This is a CIC, so you need to inform the MD. Steph, shout out to you for that answer. Let's see what else is going on. D. All right, so I think we have a good gathering and understanding of this question. Hopefully everybody has their answer. Does that say non-rebreather bag? I'm tracking what you're putting down. I'm picking up what you're putting down. I'm going to do D, then C. So this isn't select all that apply. It's just one answer. Pick it. So you want to pick this. You can't pick both answers. All right. All right. So we'll answer it. All right. Here we go. Ready. And all right. Erica said, hey, speak now or forever hold your peace. All right. So we're saying D. You're saying D. All right. Hey, no. Hey, you're cut off. Everybody's cut off. All right. Here we go. In 3, 2, 1. So the answer was D. Switch the patient to a non-rebreather mask at 95% to 100% oxygen and call the physician to discuss the patient's status. So the answer was D. The patient's history and symptoms suggest the development of ARDS, which will require intubation and mechanical ventilation. Patient with mechanical ventilation guarded against fluid overload with diuretics and given nutritional support until evidence of improvement is observed. Yeah, I didn't read the last part of the question correctly. I get it. That's what I'm saying. When you read these questions, you got to read them all the way through. That's what, like, literally, like 30 to 50% of people don't read their questions all the way through. And that right there requires discipline. Who says that you should never contact the physician? So, Sandy, if you're talking about, now it says there are certain things that you cannot do without a physician's order, right? Now, what you're probably thinking about is what they call passing the buck, right? So there's something you can't just automatically default to just calling the physician. You have to do your part before you call them. But of course, it's safety first. Which one of these things needs to be done? And if it's not done, my patient will die. And so this isn't passing the buck because you go from a nasal cannula, which is at 6 liters, right? But then you switch to a non-rebreather, and the non-rebreather is the big, like mask that looks like that goes over your nose and your mouth, which will push more oxygen to you other than through your nose because it's going both through your nose and your mouth. So you're able to get more oxygen to the body. But then you realize that your patient's decompensating. They're breathing at 38 and they have 90% O2 saturation. I can only imagine what that CO2 looks like. Right? So at this point, he's going to be breathing at 40 and he's going to be at 88%. Right? So now I'm like, oh, well, I need to switch him or her to the non-rebreather, call the doctor because we're going to have to intubate him. Because they're going to have to intubate him to protect his airway. Okay? You see, critical thinking. So remember, the NCLEX is about critical thinking and clinical judgment. Like, this is a good judgment call. You can do this as a nurse. You can do that. Okay? Yeah, you don't want to pass the buck. Safety first. Let's see what y'all talking about. Within the nurse scope of practice, you have done what you can. MD makes the next decision. Facts. Always do your part before. Exactly. We don't ever want to pass the buck. You can't be like, oh my God, my patient has said they're going to do this. Hey, you better, the answer that says call chaplain, you better not pick it because that ain't it. You may not want to do it, but you're gonna. All right. So shout out to all 84 of y'all hanging out here. We're going over NCLEX style questions. If you guys are new here, make sure you guys forward. Make sure you guys share this live stream as well as you guys follow me. Apparently TikTok won't let me be great to where I can start streaming off my computer. So I need 10,000 people to like me. So I need all 10,000 of y'all to like me. Find me 10,000 people to like me. 10,000 of my closest friends. I don't have friends because people don't like me, and that's okay. So shout out to all of y'all hanging out in here. We're doing NCLEX style questions. If you're new here, make sure you guys follow. Also, I want to know who you are, where you're from, where you're at in your nursing journey. What questions do you have? Ask myself and ask my co-host, Nurse Nelly. She's been a nurse for 4 years, ICU, med-surg, tele, and now does case management, loving her life. So I'm just saying, oh man, look, thumbs up. That's what I'm talking about. I appreciate you. Sorry, I'm back from cooking. Okay. We good around here. We still doing these questions. So we're about to move on. The answer, who is that? Alex, you already late. We already answered this question. I just started my first semester of nursing school today. Shout out to you, Tiana. Shout out to you. Oh, and that's another thing. For all my nursing students that just started nursing school, and you guys are looking for a jump on NCLEX style questions and NCLEX material, check out my link in my bio. The 7-day NCLEX course. It's currently in the pre-launch phase. Questions like this, reviews like this are going up on there. Once you get it, you have it forever, right? So be an early adopter to get you a step ahead of the game. All right. So make sure you guys check that out. The answer is not C. The answer is D. Well, I'm going on to the next question because y'all are answering and y'all just came in. But it's okay, Claudia. It's okay. Is the LPN and RN NCLEX the same? They are not the same. They are different because they are different scopes of practice. I've taken an NCLEX 8 times, going for my 9th time soon. Ebony, let me tell you something right now. I'm applauding you, and this isn't no shade on you, because for you to tell me that you failed your NCLEX 8 times and you're taking on your 9th, that tells me that you don't care about what nobody says. You about to make it happen. And that's the stuff that I like to see. For all you guys that are new here, I've taken my NCLEX 3 times, right? And I passed on the 4th. But Ebony, no one's ever going to know that you failed your NCLEX unless you openly tell them. And at that point, it won't even matter because it doesn't judge what type of nurse that you're going to be. Tell people to stop playing with you, right? Tell people to stop playing with you. You about to get out here and make some stuff work. Shay said, I graduated LPN in June and now waiting to take my NCLEX. Shout out to you, Shay. Shout out to you. Wow, awesome. You're welcome, Ebony, because I'm going to tell you right now. Look, hold on. Let me show you. Is it back here behind me? Y'all might be able to see it. I'm going to show y'all something real quick. Hold on. I'm going to be like, don't hang up. Y'all see that right there? I think somebody said perseverance. Right? That's what it is. That's perseverance. And that's just my life on a whiteboard. And that's my son. So, not to confuse nobody. All right? So that's what I'm saying. Don't be giving I don't tolerate people that give up around here. And I don't tolerate people that give up around me. And I don't tolerate people that come to me with excuses. If you tell me that you failed, cool. I'm going to be like, I'm sorry to hear that. My next thing that's coming out of my mouth is what you about to do about it. What are you going to do about it? Okay? So let me see what y'all are talking about. I'm going to go to the next question. As I'm reading this, I want to see what y'all are talking about. I passed what's the passing score for the NCLEX PN? I don't know what that means, Heather. What do you mean there is no passing score. It's either you pass or you don't. Me too. I already talked about that. I'm a new RN in Texas trying to be an ICU nurse. Also got into Texas Tech Online. Shout out to you, Jason. Shout out to you. Who is this? Jessica says 7 years in a rural level 1. Ooh, a rural level 1. ER now a hospice nurse for 2 years. Shout out to you, Jess. Can I call you Jess? I'm calling you Jess. Can you take the test if you haven't gone to school? I mean, I am a medical assistant. Could I try? No, Alex, you cannot. You have to go to school before you can take the nursing license exam. Don't hang up like 16 using the house for real, right? Giving up is not an option. That's facts. I graduated in November and I'm so nervous for the NCLEX. Caitlin, you ain't got nothing to worry about. I wanted to give up and saw Kevin. I don't know what that means. What does that mean? What does that mean, hospice? What's that mean? Starting nurse school in October and I'm so excited. Brianna, you should be excited. This is another portion of your life that you are about to endure on, and it's gonna be a tough one. It's gonna be a tough one. All right. So y'all are already answering the question. What was the answer to the last question? What was it? Let's see. It was D, the non-rebreather, to answer that question. Damn it. Some of y'all probably already started. Don't matter. Why does nursing have to be work so hard? That's a good question. Everybody say DAA. Y'all ain't even let me read the question. Y'all foul for that. You inspire me to restart my NCLEX. You should. Sandy, stop playing games. I'm super new, but I know that going over practice questions I'm trying to tell you, this is right. This is exactly why I do this right here. Exactly why I do it. Any options for clinicals and still working full time during the day? Jess, I was active duty. And I was active duty the entire time that I was in nursing school. And so I worked full time while I went to nursing school. I don't know exactly how the clinicals work. For me, I went to clinicals on the weekends because that's what my program allowed. I hear some clinicals you can do during the evening time now. They still do them on the weekends. It all just depends on what your school likes to do. Got a HESI exam and super anxious. Sincere Jen, one thing I'll tell you is that you should look into looking at the Mometrics book. And the Mometrics book is it's either Mometrics or Trivium for you taking your HESI exam. If you're talking about your entrance exam. Oh, y'all are answering the questions. I'm over here. All right, cool. All right, y'all are all right. Obviously, I'm not going to be able to get through all you guys' stuff. Are there special days that you are live? Erica, I go live Monday, Wednesday, Fridays at 5:30 Central Standard Time or Texas time because that's the only state that matters. I'm just kidding. Anyways, so let me answer this question or read this question. Oh, your exit? Okay, I got you. All right, I'm going to read this question. I'm pretty sure you guys already answered it, but I'm going to read it anyway. Which of these medication orders for a patient with a pulmonary embolism is more important to clarify with the prescribing physician before administration? Is it warfarin, 1 milligram by mouth, PO, Morphine sulfate, 2 to 4 milligrams IV. Keflex, 250 milligrams by mouth, or is it heparin, 900 units per hour? We're saying D. D. Let's see what's popping. Maddie says B. I saw some other people. Warfarin for pulmonary embolism. D. Heparin is fast acting. I heard you ask and immediately said heparin. Oh, okay. Shout out to you. Tipsy B says C. User 41 or wait, what is it? Yeah, 41 says D. Is it Kaz U2 says D. Heparin is prevention. Brandon, okay, I see you. Didn't even read the answer. Well, I'm gonna need for you to read. Okay. How long does it take to get a license in Texas from another state? Sorry, this is out of the discussion. Well, I'm going to answer that here in a second. Hold on. As a matter of fact, I'll probably forget. So once we answer this question, you have to ask me again. D, what's the route? For D, how else do you give heparin? Per hour heparin amount. So those are one of those things. It's just like you're asking how to give the route. When it comes to certain medications, what if they just said heparin? What are ways that you can give heparin? IV sub-Q, IV, right? IV, sub-Q, right? IV and sub-Q, right? So then that right there, did you just put a needle on up here? What's up with that? Oh, okay, I got you. Push, stomach, yep. Stomach, that means subcutaneous, right? We don't want to just, I don't want to grab an IM needle and stab it in somebody's stomach. That would be terrible. Oh my God, that would suck so bad. All right, so I think we have a general consensus, right? So here, think about what's going on with my patient, right? Medication ordered for a patient with a pulmonary embolism. Now, take the picture. What is a pulmonary embolism? Think about it in your head. You don't have to answer it, right? Pulmonary embolism is more important to clarify with the prescribing physician before administering. So what do I need to talk? In regards to talking to the physician, right? What is the most important thing that I need to talk about in regards to the medication? Like, which medication do I need to be like, hey, we need to talk about this, right? 1 milligram is not accurate. I'm a nurse and I say B. All right, cool. I'm a nurse, Kim, and I say not B. That's just me, though. A, no trailing zeros. You're thinking about the trailing zeros? I didn't even think about that. Embolism movement. Okay. D, because there is no route. I'm not saying it again. Say D. So D, B. Obviously, we're all over the place. So we're just going to end. It says, oh, it's not that important, but it's true. No, it is true. I honestly didn't even think about that until I saw it. Right. All right. So here we go. The answer is warfarin Coumadin, 1.0 milligrams by mouth. See, I laugh, and that was the answer. Y'all, it's in the answer. There it is. A. It's A. What? I know, that's crazy, right? Y'all, A. Yeah, see, that's what I'm saying. Look, Mama G. Hey, listen, I didn't knock your answer. I didn't knock your answer at all. What? Brandon's like, who? Hey, y'all wild out here, right? Layla said, I'm a nurse. Layla, that's cool. I'm a nurse too. Welcome. Shoot, I was going for A or D. It's all right, Kim. It's all right. This is why I like doing this, because it's practice, right? Let's look what the rationale. It says medication safety guidelines indicate that the use of a trailing zero is not appropriate when writing medication orders because the order can easily be mistaken for a larger dose, such as 10 milligrams. That's right. The order should be clarified before administration. The other orders are appropriate based on the patient's diagnosis. So I'm going to give you guys a really good example right now. When I was a nursing student, we had an order to give our patient 2 units of insulin. My dumbass wasn't paying attention, and I pulled up 20 units inside of a syringe. Yeah, I know. Let's hear it. Y'all are like, oh my God, right? Like, it's wild. It's wild, right? So luckily for me, I had a really good preceptor. Yeah, whoa. Luckily for me, I had a really good preceptor, and I showed her. I was just like, hey, is this the amount? And she looked at me. She was just like, she wasn't even mad, but she knew that she was going to check anyway. And I looked, and she was just like, now, what does the order say? And I was like, 2 units. And I thought because it said like 2.0, I thought it was 20 units. But you see how easily that you can get messed up like that? Exactly. Always check off your insulin. So now I have it stuck in my brain. Any medication that I give, and I mean any medication, not insulin, not just insulin, but if it's like, I was about to say Flexeril, but if it's like Dilaudid, if it's Versed, if it's fentanyl, if it's anything like that, I'm just like, look, do you see, you know, zero point 0.4 milligrams in this syringe? And they're just like, yes, I see. Okay, cool. And then I go and I document it, and then I go administer to my patient, right? Hey, shout out. Hey, listen, I just want to let y'all know, Nurse Cass is in the building. All right. Nurse Cass is my other co-host who decides to show up whenever she wants, because then, you know, that's just what she does. 17-year nurse, does corrections and psych. So I just want to let you know her theme song is Nuck If You Buck, because she will fight you. So I need at least 40,000 likes, and I need like 100 people to share this, because she will literally come into your DMs and throw hands, and it might just be like one of those fist emojis, but you know, whatever. But shout out to Nurse Cass. Welcome. I know you told me you were going to be here, so it's all good. I start my senior year tomorrow, and I'm so nervous. Nervous about what? You done made it all the way through school. Now you see the finish line, right? And now, so don't stop. Don't stop. Okay? Nuck If You Buck is a great thing. Look, I'm trying to tell you. Like, there was one time she came on here, and I couldn't help but I already had Nuck If You Buck ready. Not the fist emoji, I know, right? Everybody who works in psych can, hey, look, I did 15 minutes. I did 15 minutes in my psych rotation, and there was a code green, aka there was a combative patient, and it wasn't for me. Let me tell you something right now. Well, okay, what was your question, Limo? Ask your question right now. I done already forgot. I'm sorry, I done already forgot. And then they put me in the adolescent females, y'all. They put me in the adolescent females when I was in psych. Why would they do that to me? I've never felt so objectified in my entire life. It was like watching like a pack of hyenas about to just murder me, bro. Like I wasn't ready for that. I wasn't ready for that at all. And I was like, please don't ever do that to me again. Hurt my feelings. Bless your heart. I'm just saying that ain't cool. I wasn't liking all that. Don't laugh. Can't show the fear. Look, all the fear was shown on my face around these between 13 and 17-year-old girls. Nope, I didn't want to be there. How long does it take to get a license in Texas from another state? So it usually takes anywhere from like 60 to 90 days if you transfer your license from one state to another, because Texas is part of the NLC, which is the Nursing Licensure Compact. So once you get to Texas and you're here for like 30 days, you have to apply for a Texas license, and it usually takes like 60 to 90 days. So I don't work females, never have, never will. Look, I don't blame you. All right, so somebody's yelling at me, telling me to go to the next question, because apparently you guys don't like my commentary, so whatever. Next question. Here we go. You are acting as a preceptor for a newly graduated RN during her second week of orientation. So this is about to be a lot of y'all, right? You would assign the new RN under your supervision to provide care to which patient? Select all that apply. Is it A, a 38-year-old with moderate persistent asthma during discharge, a 63-year-old with a tracheotomy or tracheostomy needing tracheostomy care every shift, a 56-year-old with lung cancer who has just undergone a left lower lobectomy, or a 49-year-old just admitted with a new diagnosis of esophageal cancer. Tipsy says B, the most stable. Sarah says B and C. Air Chairmano, is it Chairmano? Says B. Yo, y'all with the names. Y'all are something else, yo. Straight up. Hey, shout out to all 247 of y'all hanging out. 250. Make sure you guys like, share, subscribe. Like, this is on YouTube. Y'all know the deal. Welcome. You guys participate. We're doing NCLEX style questions right now. If you guys got any questions about anything, drop them down in the comments. Make sure you guys blow that like button up, and make sure you guys share. I need 10,000 friends to like me. If you fail NCLEX, what's the best way to study, or what program recommendation can you make? Well, what does it say? Love what? Love. I'm just going to call you Love. That all really just depends on you. A lot of programs out there are great, and they have stats to show that their stuff works. But then again, that all just depends on you. I personally don't know anything about you. So the one thing I'll say is, what are your study habits like? What's your time management like? What's your life like? Do you understand NCLEX style questions? Do you understand content? Do you know how to apply that content? Like what's your accountability? Like what's your support system look like if you have one? You know what I'm saying? NCLEX High Yield is a pretty good one. Archer's a pretty good one as well. But like I said, I can look, we got NCLEX High Yield, you got Archer, you got UWorld, you got Kaplan, you got Hearst, you got Mark Klimic, you got Remar. There's so many other ones that are out there. But then again, in the end, it doesn't matter which ones you use, but you have to really think about all the other things as well. Because to do the content and do NCLEX style questions, that's great. But you got to think about everything else, because if you have environmental factors that are distracting you, like I did, the times that I took mine, that could really be detrimental to you. But if you want my opinion, I think Kaplan is great, and I think Archer is great. I personally don't like UWorld. I love Mark Klimic. I love everything about Mark Klimic. Oh, y'all are answering. I'm over here talking. My bad. So some people say A, B, A, C. My bad. I'm getting it. I'm getting it together, y'all. I promise. I'm getting it together. All right. So some people say A. Hey, so remember, this is select all that apply. So remember, it could either be one, a few, or all of them. So think about that. All right. No problem. Does that say Crystal? Crystal says B. Okay. All right. So we're pretty much all over the place. And I like to select all that apply questions because, you get different answers from people. Definitely need the rationale for this one. For sure, Alex. A and B, A and B, A and B, here for conversation. You're here for conversation. You're here kind of late, but I appreciate your answering. So the answer is A. Omar says A is stable. Hey, remember, this is a select all that apply question, guys. Remember, we got to read the question all the way through. Okay. A, B, or blah, 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 blah. Is it just one? I read no. What? Is it ever just one? I read no in my trust strategy book. So I actually have had answers, like even when I've tested, like when I was testing with Kaplan and when I was testing with UWorld at some point, there were answers where it was just one. But it's rare. And it's rare to have them all be the right answer too. So didn't say that it was only going to be that, but I'm saying that the choice is there. I passed NCLEX beginning this year. This brings back bad memories. Hey, that's okay though. Look, that's a part of life that you probably ain't got to worry about no more, but it's there. It's there. I actually embrace this. Like, I don't know why, but it like something about this and being on here talking to y'all about it, it makes me happy. It really does. All right. So I think the suspense is enough. So PTSD from NCLEX. Look. Okay. Is it Jackberry? Jackberry. I'm just call you JB. JB, really? I'm going to need for you to not have that. But the NCLEX will do that to you for sure. All right. So I'm going to answer this question in 3, 2, 1. Oh, the answer is A and B. All right. A patient who is waiting for discharge may be stable enough for the care of the student nurse. The client is the center of care. The needs of the client must be competently met with the knowledge, skills, and abilities of the staff to meet these standards. So we said A is a stable patient. They have moderate persistent, right? And it says a new RN is at the early point of her or in her orientation. The most appropriate patient to assign to her are those in stable condition who require routine care. In other words, the nurse who delegates aspects of care to other members of the nursing team must balance the needs of the client with the ability of those to which the nurse is delegating tasks and aspects of care, amongst other things such as the scope of practice and the policies and procedures within the particular healthcare facility. I'm not even gonna lie to y'all, that was a mouthful. Look, I'm telling you, it was hard for me to read that. Probably because I'm thirsty. But yeah, so the answer was A and B. And so here's the thing about select all that apply questions for everybody. One of the biggest things that I've read is that most people, when they do select all that apply, they select one more than they should have selected. Okay. One more than they should have selected. Kevin, Kevin will ask, can I call you that? And call you that anyways afterwards. My bad. I'm sorry. It was like JB, like J. Was it Jackberry? Can I call you JB? That's cool. I'm gonna call you JB. Hey, look. So I've been in the military for a long time. So sometimes we'll come up with nicknames with people, and then we'll just call them that. And I'm like, my bad. I'm sorry. All right, look at that, Look, that's what I'm talking about. JB, I got you. I got you out here. I'm starting my RN program, going to my second semester to take human biology and humanities. Well, shout out to you. Hey, I'm telling you right now, ain't nothing that YouTube can't get answers to. You like JB? Ain't nobody ever called you JB before? I mean, I'm pretty sure nobody outside of, TikTok is like, hey, what up, Jack Berry? You're going to be like, what the fuck? How long were you in the ICU? I worked in the ICU for a total of a year. I worked in a burn ICU for 6 months. Then I worked in a medical and a neuro ICU for 7 additional months. So a little over a year. Kevin, you should give my mom a theme song. I should. All right, fine. I don't know what theme song I would give her, Aubrey, but we'll figure that out. I haven't really gotten it much. Oh, okay. I'll just call you JB. Had my first day at nursing school today. Shout out to you, Ron. Let us know how it was. You were probably nervous and you were probably just doing orientation stuff. And then the real fun's about to begin. Then the real fun is going to begin. We're going to go to the next question. So excited to start. That's what I'm talking about. Just get it. Hey, be excited to start. Hold that excitement up there and just put your head down and push your way through. Hey, for my individuals that are starting nursing school, one tip that I'm going to give you right now is to get into a group of 3 people and then you. So that's a total of 4, right? That way you guys can split up the notes and then combine your notes when you guys are studying for an exam or a lab, so on and so forth. Divide and conquer type deal. And it also helps you adopt the teamwork aspect, because once you become a nurse, trust and believe me when I tell you, you're not gonna be able to do everything. So you might as well just get into that habit right now. Okay. I don't know what I said, Aubrey. What you mean? What does it say? Any place to get nursing school books cheap? Amazon. I did my LPN, but my school closed. I was supposed to graduate last April, but I know that's right. I know they had a lot of these pop-up schools that were just doing whatever the hell they wanted and taking people's money and then not being accredited or anything like that, messing around with people's hopes and dreams. I wasn't a fan of that either. So I'm sorry if that happened to you. Kevin, I'm sorry. I didn't hear what you said. Oh, Aubrey, I said that I'm going to come up with a theme song for her, but it's just something I have to think. You know what? I think I do have a song for your mom. I'll figure that out. All right. So here's our next question. Jenna is a nurse from the med-surg unit of a tertiary hospital. She was asked to float on the orthopedic floor in which she has no prior experience working on. Which client should she be assigned to? A client with a cast for a fractured femur and who has numbness and discoloration of the toes. Or is it B, a client with balanced skeletal traction and needs assistance with morning care? Is it C, a client who had an above-the-knee amputation yesterday and currently has a temperature of 101.4? Or is it D, a client who had a total hip replacement 2 days ago and needs a blood glucose monitoring? Janine says C. Mary says D. Other people say D. You definitely say not B. C, D. Okay. Aubrey, okay is not an answer, silly. D, C. Sev says C. Ebony says B. El Chermano says, I think he said D. I think he said D. I'm not sure. So, all right, we say D. Remember, paint that picture. So having somebody float to a floor that they have never been to before is equivalent to what? Ron says B. I don't know at all. Now guess the rationale for why. Being new. Ron says being new. So it's just like being a new grad, or it's just like being a new orientee, right? So Janine, here's the thing, right? Glucose monitoring is something that the tech can do in the real world, not in NCLEX world. Give most stable patient, right? The rest are potentially unstable. You have to have a stable patient. Okay, say B. Okay. Whoops. All right, well, then I say D. Okay. All right, Janine, I got you. We say D. Me, a finance grad, interested in this. Are you really, Kate? Don't lie to me. Don't come up in here with the nonsense, okay? Wait, are you though, really? Jackie says C. I'm serious. Okay, I hear you. You ain't got to scream at me. I got you. So what's the answer? All right, so here's the answer. The answer is, here we go. It's D. A client who had a total hip replacement 2 days ago and needs a glucose monitoring. Right? So a nurse from the med-surg floor floated to the orthopedic unit should be given the client with a stable condition as those, oh my God, I can't read, who have care similar to her training and experience. A client who is in a postoperative state is more likely to be in a stable condition. And here's another thing. Wait, hold on. What you mean, Kate? What you mean? I ain't do nothing. D is stable. Yeah, I passed. Yeah, she's like, yeah, I got the answer. Woo woo. Oh my God, I failed. Kate, stop. Stop it. Stop it. Real life answer, you get them all. From med-surg and floated many times. Yep. But we ain't talking about real life answer, Lita. Don't do that. Don't do that. Right? So let's see. Where were we at? No, we weren't there. Okay. So we're not talking about real world. We're talking about NCLEX world. You start thinking like real world, you're gonna fail. Like me. 3 times. I don't want that for y'all. Love me. Give me likes. Share my stuff. Love you. All right. I've been taking NCLEX quizzes now and I love it. Look, Mary, look at that. So you're already prepared. You're already preparing, and you're not even done with anywhere close to done with being with nursing school. The more you do, the better you get because you teach yourself what it's looking for. Absolutely. Where are you taking these on? What are you talking about, Janine? Where am I taking these on, or where am I taking these from? Is that what you mean? Because this is on a PowerPoint. See, PowerPoint. Let's see. Shoot, I failed twice and I'm nervous about the new gen. Don't be Isabella or Isabel. Don't be nervous about the exam. The only thing that's different about the exam is the way that the questions are delivered to you. They're still going to be delivered in multiple choice, select out of the apply. They're doing case scenarios in there. They're doing multiple responses. They're doing all kinds of different stuff, but the content in the question is still there. The great thing I like about the case studies, they can ask you 6 questions in one case study. But then when they do that, like they'll ask you like, hey, like, highlight the most important things that are in this paragraph. You know what I mean? I really do appreciate your words. You're welcome. Do you do NCLEX prep for new generation NCLEX style questions? Yes. So these are the only questions. These are the questions that I could find, Melissa. So, but I'm working on getting next generation or new generation NCLEX style questions. But remember, like I just said, all you got to do is just look at the format, but the content for itself is not going to change. And if the content does change, it's very, very subtle. Like you would never really notice it. I'm a new grad, 4 months on my own. This is a cool review. Oh, I'm glad, Sarah. Thank you. Next generation is easy. Look, JB done said it. JB done spoke and said that the next gen, to me, hindsight's 2020. I think the next gen is easier than the old one because, like for select all the apply, for example, you had to get it right. With this one, you get partial credit, So, so many of my friends told me that the NGN is so much easier. It is much easier because, especially with the case studies, they give you all the information that you would need. They give you the history. They give you the vitals. They give you the lab trends. They give you times. They give you the health and history. They give you all that stuff. Is it true that if you don't get 100% on the exam, your graduation gets pushed back? I don't know. That depends on your school, TikToker. So is it really the same, just worded differently? It's more about how the format is. It's more about how it's formatted. So this is select all that apply, and it is select all that apply and multiple choice. Now I could literally take this whole question and then elaborate on it and give you a history of the patient, so on and so forth, in order for you to answer the question. Like I said, it's all about the caliber of how what's the word I'm looking for? It is how the questions are delivered, right? Where did you get these from? I got them from a lot of places. Some from UWorld, some from like my old reviews. So that's where I got them from. Melissa said, okay, thank you. Thanks, you answered me right as I asked. Okay, got you. Next question while you talk so I can read. First of all, whose time are we on? Yours or mine? What's wrong with you? I'm just playing. Hold on a second. I'm trying to catch up, y'all. Trying to catch up. Is UWorld a good study source? TikTok, it all just depends. It all just depends on you. All right. If you have a good standing of understanding NCLEX style questions, then cool. But me personally, if you were to choose between a QBank, I would choose Archer before I would choose UWorld because it's cheaper, you get it longer, and they give you content. So, which intervention for a patient with a pulmonary embolus can be delegated to the LPN? Right? Is it A, evaluating the patients complaining about chest pain? Monitoring lab values for changes in oxygenation, assessing for symptoms of respiratory failure, or D, auscultating the lungs for crackles. You say D. 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 Ron says D. D. Who said B? Oh, we got some B's. Okay, cool. B. B. D. You're back? I never knew you left. I thought you were still here. D. D. Me who doesn't know how to use a stethoscope? Really, Ron? I don't know. That's funny. All right. You lying? It's all right. Some people don't know. It's all good. LPNs can't evaluate. Still did this yesterday. Wait, what? I still did this yesterday in my clinicals. Okay. Quesadillas. All right. I'm sorry, D. Don't be sorry. You good. What you mean? What you mean, Nelly? LPNs can monitor, but auscultation is an assessment, so B. D. A. Adpire. Yeah, I'm assuming you mean AdPi. I think it's B. Only RNs can eat, evaluate, assess, and teach. AdPi. I'm tracking. I got you. D. B. C. I don't think techs can assess lung sounds. No, techs cannot. She did. She did. I want to say B because auscultation is assessment, and that's for RN. Only RNs can AdPi. Okay. I hear you, Jay. I'm tracking. I'm picking up what you're putting down. Picking up what you're putting down. All right. So I think we have a general consensus. Like everybody is like all over the place. They know it's definitely not this one. They know it's definitely not this one. So it looks like you guys are choosing between B and D, I think. Okay. Well, Stacy says A. So forget whatever I just said. Lindsay says B. Is it glittery? I was about to say glitty. Glitterily. Oh my God. Whatever. You know who you are. You said B. Dag says D. ICU Dynamic Girl says A. Sarah says 100. You gonna die on that mountaintop, Sarah? Saying 100% B. Okay. Actually, in Georgia, LPNs don't do that. It's not about Georgia. It's about a standard. It's about a standard across the United States and Canada. I bet $1 million it's B. Oh, okay. I want to see what that bank account look like. Stacey just joined. Oh, okay, Stacey. I got you. Answer. All right, cool. Delegate. All right, here we go. Answer in 3, 2, 1. The answer is D. Auscultating the lungs for crackles. Listen. Did you know that LPNs can auscultate lungs that have crackles? Now you do. Yo, I've been waiting to say that all day. I don't know why. All right, here we go. An LPN who has been trained to auscultate lung sounds can gather data by routine assessment and observation under the supervision of an RN. The scope of practice for the licensed practical or vocational nurse will most likely include the legal ability of this nurse to perform data collection, plan, implement, and evaluate care under the direct supervision and guidance of the registered nurse. Because it's not head-to-toe assessment. I'm in nursing school and currently being taught evaluating equals assessing. Yup. Cake, what's that mean? The coffin, what's that mean? Does that mean dead? Is it because of what I said? She's like, oh my God, you sound like my favorite TikToker. I like that dude. I had no idea he was in the Air Force either. And so now it's just like, now I know he and I really connect. Listen, did you know? Now you do. So it seemed as a focus assessment. Me either, right? But yeah, so your answer is D. So also, this is just another like nugget for everybody is if you get the answer wrong, do not skip these. Like, here's your right answer, right? Here's your right answer, but don't skip these. You need to read them and understand why they are the incorrect answer. So if you got this answer right, cool. But then you need to understand why these are not the right answer. And if you got the answer wrong, you need to understand why these aren't the correct answer and why that is the correct answer. You see what I'm saying? The rationales literally saved me and helped me. I'm telling you, you will learn so much because you'll get to this point of doing your reviewing, which is what I like to call it reading and reviewing. You'll get to this point and you're going to be like, man, like that doesn't make any sense. So what are you going to do? You're going to go to Google and do your thing. And then you're going to find another source and you're going to be like, oh, okay, that does make sense. Right. And then it's one of those times it's just going to stick inside your head. Okay. How many questions we doing tonight? Well, this is the second half of the questions that I did on Friday. So 25. And so now we're at 21. Always understand why the answer is wrong, why the wrong answer is wrong. It helps you make your own rationale. Facts. All right, hey, we're doing well out here. We're doing well out here. Hey, if you guys are new here, welcome to the stream. My name is Kevin. I go by the Boot Nurse on all social media platforms. If you are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. If you're a brand new nurse looking to get a jump start on NCLEX or, content and then soon to be NCLEX style questions and videos, make sure you guys check out the 7-day NCLEX course. That link is in my bio. It's going for $48. And once you get it, you have it forever. So if you're a brand new nursing student and you don't graduate for another year, 2 years, 3 years, 4 years, however long your program is, you can say that you got a review and help build it for $48. So make sure you guys go over there and check that out. Let's see. They do not. NCLEX world is crazy. Facts. All right, here we go. The nurse plans care for a client in a post-anesthesia care unit. So post-anesthesia, the PACU, right? Which of the following should the nurse assess first? Respiratory rate, level of consciousness, level of pain, reflexes, and movement of extremities. K Gibb, you're going to be famous soon. Look, I'm trying to get my life together, right? Airway, breathing, circulation. All right, Jess the mess. I don't know why I just called you that. I don't mean no disrespect to you, ma'am. I'm just letting you know what's up. So as somebody who used to work in PACU, I definitely know what's up. Can you repeat the website? The website, the link to my 7-day NCLEX course is in my bio, and it'll take you directly to the website. I'm not even a nurse, but for some reason, your way of presenting is engaging. I just want to let y'all know I've been teaching for 8 years. I first taught in a surgical technology program for about 3.5 years. Then I taught in other programs while I was in the Navy. I became a master instructor in the Navy. And this is exactly how I taught. Like, I'm very engaged. I'm very energized, very, try to be dynamic because sometimes this stuff is boring. And who the hell wants to sit here and just be like, the nursing plan cares for a patient? Like reading it like that dude off Ferris Bueller's Day Off, Ben Stein, I think his name, like Bueller. Ain't nobody trying to do all that. All right. So I try to make it engaging and I want it to stick. That way everybody understands. Okay. So I see a lot of people saying A, B, C, D. I worked in the PACU for 5 years. PACU is gangster. I'm not even gonna lie to you. I love PACU. He's awesome. I'm really just okay. Hey Kev, what's up? What's up, Priya? I'm looking towards going into the nursing journey next fall. All right. Is it Sierra? I wish I would have had someone like you. Look, Jess, the mess, ma'am. I understand. I got you. That's why I'm here. This man definitely taught me a lot during my NCLEX journey. Facts. Let him know, Jason. Let him know what's up. FYI, I did not plant Jason here. I did not know Jason was going to be here. So, let's see. Cause right after they might not be conscious. True. What's the answer? Well, answer. All right. I'm gonna need for y'all to stop yelling at me. Okay. Number one, sensitive out here. All right. So the answer is, it is A, the respiratory status. Assessing respiratory status is the first priority. Facts. And here's the reason. They're coming from general anesthesia and mechanical ventilation, right? So even in normal individuals, a result in decreased oxygenation in the post-anesthesia period can happen. They also cause a reduction in functional residual capacity of up to 50% in the pre-anesthesia value. Y'all hear that boy? Y'all hear him? I don't know what his problem is. Uh-oh. Here we go. All right. I got to angle some stuff real quick because the way that my laptop is set up, the way that my stuff is set up, my checking and my savings, y'all know the deal. Oh, bro, I can just do this. Get out of the way, speaker. All right, I gotta move some stuff around real quick. All right, there we go. How we doing? I was talking about to ask if he was okay. Oh, he's good. He's all right. He good over there. He's the mascot, so to speak. So shout out to all 174 of y'all hanging out. We're going through our NCLEX style questions. Welcome if you're new. I want to know who you are, where you are at in your nursing journey. Let us know. I got this one right. You don't even know. Oh, wait, yeah, you did get this one right. All right, but we do understand it's like when somebody comes from the operating room and they've had a surgical procedure, or they've had a surgical procedure or some type of invasive procedure. So that could be a colonoscopy, that could be a bronchoscopy, that could be a minor surgical procedure where they're under general anesthesia, all that good stuff. The very first thing we worry about is the respiratory status because you could lose your airways super fast. I can't even tell you I've heard some stridor sounds when I've been in the PACU, and when I tell you every head turns around being like, yo, what that is? Yo, don't be breathing crazy over there, right? So then that is the biggest thing that we worry about. Everything else comes second. Their level of consciousness, they're probably going to be still sleepy and not responding to you. That happens often, right? So, reflexes and movement of extremities probably won't be moving them because they're going to be asleep, right? And in level of pain, you won't know that until they wake up. And 9 times out of 10, they're going to be in pain in some way, shape, or form. So the primary assessment, the first thing that we do is that we monitor the respiratory status. I think we're all tracking on that. I don't know what happened here. All right, here we go. Go to the next one. All right. So it's always the ABCs. Some are not always the ABCs. Not always the ABCs. And that's where NCLEX will get you. Okay. Let's see what we got. Not always. That's right. All right, here we go. Nurse Jackie is reviewing the diet of a 28-year-old female who reported several months of intermittent abdominal pain, abdominal bloating, and flatulence. The nurse should tell the client to avoid essentially, what food? Fiber, broccoli, yogurt, or simple carbohydrates. A, broccoli. B, oh, nutrition is my nemesis. Look, ma'am, respectfully, you got to fight back. You got to fight back. Say broccoli. All right, cool. We got broccoli. Fiber helps with stomach issues. You are correct, Misha. It does. It does do that. But what else we got? We say B, 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 B. B, 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 go Bayside. broccoli. I know what I'm talking about. Shout out to y'all. All right, here we go. What are we talking about? So we got C on here. We got B. Fiber will make it worse. Kendra says D. I say C. Dairy products will irritate. That's true. They can. Stephanie says D. Summer, no, you did not just come up here and say E. All the above. What are you doing? Oh my God. Well, broccoli is high in fiber. Okay. Isabel says B. Sarah says A. I'm avoiding fiber. Like in real life? You don't want to avoid fiber in real life. You want some of that. You want that in your life. Broccoli. I meant D. Nah, you meant E, Summer. Don't be coming up here with the nonsense. You know what I'm about? So it's B. Okay. Misha, you gonna die on that hill and say it's B? Because you said it a lot. Broccoli makes you gas. It makes you fume. Jewel says C. Misha crying. Misha, don't cry now. You said it's B. I'm asking. All right. Facts. All right, cool. All right, here we go. We'll get the answer. And 3, 2. The answer is B. See, look, you should have died on that hill, Misha, just for the simple fact you knew what the answer is. That's another thing. If you know what the answer is, like if you pick your answer Like, unless you can 100% tell me, why the answer you're about to pick is not the answer that you currently have, you better not change it. I want you to listen to me. I want you to hear my voice when you're going to take your exam or any exam. Like, as soon as you're about to change it, I want you to hear me and be like, what are you doing? Why are you changing it? Are you 100% sure that the answer that you're about to change is the correct one? Are you sure? Okay, I'm just asking. I have my license, you don't. You better hope so. Yep, do it. I'm just saying that I want you to hear me. I want you to hear me as I'm saying it. I want you to hear me, okay? All right, so B, broccoli. Broccoli is a known to be gas forming, which can lead to bloating and therefore should be avoided. In general, gassy foods are those that contain certain sugars, such as fructose, lactose. I don't know what that word is, and I'm not going to say it. Is it raffinose and sorbitol and / or a soluble fiber? These substances are not digested at the level of the stomach, and thus makes their way down to the intestines, where bacteria break them down. The end result of this breakdown is a release of gas. Ew. I'm just saying. Hey, look, Jess, I'm just trying to let people know what's up. Hey, if I'm lying, then, the answer wasn't broccoli, but the answer was broccoli, so I wasn't lying. So there's that. Never change your answers, right? Never change your answers. They're all good answers, but what is the best answer? So the thing about it is, like, the way that I like the way that you said that, is that CF mom? I like the way that you said that, but it's just like, usually you'll have two answers that aren't right. And then you'll have two answers that are right. And then one that's more right. Right? Correct? See what I'm saying? See what I did there? The more you know. Never. There it is. All right. We'll go on to the next one. Oh, wait. Was that the right one? Yeah, that was the right one. All right. Hey, so we're on question 23. So y'all know what that means. We got this question and then two more. All right. So shout out to y'all for hanging out. If you're new here, make sure you guys share, you guys like, you guys follow, because I need 10,000 people to be my friend. I need 10,000 people to like me, okay? Okay? Make it happen. Now, I love you. Anyways, so the nurse is planning care for a client who had undergone a colposcopy. I was about to say a colectomy, but that ain't it. Which of the following actions should the nurse take first? Right? Discuss the client's fear regarding a potential cervical cancer. B, assist with silver nitrate application to the cervix to control bleeding. D, give instructions regarding douching and sexual relations. Or D, administer pain medications. One of my professors is a military nurse that will make you second guess your life. Are you sure? Hey, what's that new meme is? Are you sure about that? So like I said, who said that? Who said that? Okay, so Mama G, like, as an instructor, I do that same thing. All I say is, are you sure? And I don't say it as a way to contradict you. I say it like, are you sure that's your right answer? And at that point, you question your thoughts. Because 9 times out of 10, the answer is right. 9 times out of 10, the answer is right. Colposcopy, not colonoscopy. Correct. Did I say colonoscopy? I meant colposcopy. They should be known for those. Yeah, so did I. When I first read it, I was just like, colposcopy. I was like, oh, yeah. Now I know. I mean, if you don't see these procedures often, then sometimes you just got to look them up. That's what I did. B, D, B, 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 B. I don't know. I don't know that you would have bleeding from the procedure. So now at this point, now it's just like, how do I effectively guess? Right? How do I effectively guess at this question? Okay. I'm going to try to read some of these and I'm going to answer that. It's C. Tipsy says it's C. Okay. So now let's think about this. Now, you have a patient who's undergoing a procedure, right? But you have no idea what this procedure is, right? So the very first thing is, like, we can go back to ADPI, right? So first thing is, like, do I want to assess or do I want to implement? But I don't know what I want. I don't know what I need to do first, right? Because the question is not really giving me anything unless you know what the procedure is, right? Matt, are you asking in regards to if that's colposcopy is correct or not? I'm assuming that's what you mean, right? Because I didn't spell it. I just, grabbed it from my old stuff and I put it on here. So I don't know what that means. I don't know what that means if you're trying to be funny. So, oh, hey, that's another thing. So, hey, if anybody comes into this chat, and this isn't to Matt who just did that, but if you come into my chat and you start trolling, I'm gonna give you a 600, and a 600 means 600 seconds, which equals 10 minutes, and that's how long you're gonna get banned. AKA, I just like saying 600 because it's a trigger word for me to just ban you forever. So if you come into my chat, you start talking stupid, I'm gonna ban your ass. I'm gonna let you know right now, or my moderators will do it, whatever. So don't come up in here acting stupid. All right, so. Think about the procedure. Okay, cool. You don't know what it is. Now look at your answers. Now, what answers in regards? So, what are some answers in regards to like if we're thinking about like ABCs, right? B, Misha. B, safety, right? So remember, what is the thing? Like, what do you need to do first, right? They had undergone a colposcopy, right? So they've already had the procedure done, right? So it says, what action should the RN take first? What do I need to, if I don't do this, my patient will die. We got some C's, we got some D's, we got some E's, all the aboves. Wait, nobody said that. I think I'm just making that up. Yep, B. Yup, B. B, C. Okay, Mama G, I got you. I see you. Katie says B. Summer says LOL. Summer, that is not an answer. Oh, I missed undergone. This is why it's important for you to read your question. Read every word, right? Read every word. All right, I think I've been hanging on this for long enough. We're going to answer the question in 3, 2. All right, so the answer was B. Assist with silver nitrate application to the cervix to control bleeding. A colposcopy is a procedure to examine the cervix, vagina, and vulva for signs of disease. The priority nursing action when caring for a client who underwent colposcopy is to assist in controlling potential bleeding by applying silver nitrate to the cervix. That was a hard one, yeah. That was a hard one. Calliope, you been in here the whole time? Calliope, I ain't seen you answer nothing. Don't be telling me to say slayed that when you just came in here. Don't come with the nonsense. Don't go, exactly. Do not go. It says don't go by real life. That's what I'm trying to tell people. I'm trying to tell you. What part, user 73, what part do you want me to re-explain? The nurse doesn't do that. That is the provider. Pam. It doesn't say that the nurse does it. It says assists with. So the nurse is assisting with doing that. Of course, the provider is going to do it. Should we always think of these questions as what will make the patient die first? Yes. Or what patient will die if I don't get to them first, especially if you have those, management of care question. Well, when you said it like this the last time, you can do the help your patient. I got B. What? Reading is fundamental. Stop it. Okay, that helps a lot. Thank you. No problem. So, Cami says, hold on, Cami. I want to make sure I understand your question. Well, when you said, if this is the last thing you could do to help your patient, I got B. Correct. Now, there's a big difference by saying what is the most appropriate thing to do or what is the best thing for you to do versus what is the first thing that you should do. Because when you think of first, I think of things in steps. So systematic. I need to do this, do this, do this, do this, do this for my patient. Now, when I say most, like what is the most important or what is the best thing to do? If I could do one thing to save my patient and then I had to leave, what would it be? Does that make sense? Does that make sense? You're welcome. Come on, Cammie, I need for you to let me know if that makes sense. Oh, now you follow me, Cammie? See, that's rude. I don't even want to answer your question now. That's mean. No, I appreciate you following me. Thank you. Okay, cool. All right, cool. So everybody's cool. We're happy with that. That makes sense to me and how I was taught. Exactly. That's exactly how it is, right? All right. And then like I always say that if you got this answer wrong, if you got this question wrong, of course, read the answer on why it's right, but then understand why the one that you picked was incorrect as well as the others, because you have no idea what other type of question could be formulated later on in your exam based off of some stuff you've already seen. Okay. First and best are always different, right? Correct. Stangal. Yes, they are. Because like I just said, first is based off of a systematic approach, as in like, steps 1, 2, 3, and 4, versus best is like if I had to do one thing to protect my patient and save my patient, and then I left to go help with somebody with a code blue, what would it be? You know what I mean? All right, on to the next one. All right. 24. Sally is a nurse working in an emergency department and received a client after a radiological accident. Now paint the picture. A radiological accident. Which task is the priority for the nurse to do first? So what is the very first thing that I want to do as a nurse? Now paint the picture. What is a radiological accident? And no, I'm not talking about x-ray. What are we thinking? What are we thinking? I need answers. I used to say Mark Clemick is NCLEX Bay. Hey, shout out to, I'm letting you know, Mark Clemick is my dude. D, I think. Okay, Avery. Avery, you must be new. Are you following me? You better be following me, or I'm sending somebody into your DMs and they're gonna harass you. I'm just playing. Don't do that. Avery says D. Mama G says D. Chris says A. Natalia says A. Tipsy B says, what did you say? You said A. What did you say? It's like the chemical stuff, like the radiation. See, yeah. So it's like a biological attack type deal, or like imagine like if somebody dropped a nuclear warhead on us. Did you just call me radio? What? All are correct, but the answer said first, so it's A. Okay, Lou. D or A. Kenya says A. How do you even decontaminate? I'm curious. They have decontamination stations, essentially. Like if a biological attack happened to us in any way, shape, or form, there are decontamination teams, aka the fire department, that usually set stuff up like that outside of facilities. In the military, we had decontamination stations that we set up in case of biological attacks. If you don't contaminate the clothing, it will be brought into the building. Okay. I would pick B. Okay. Cry and refuse the assignment. What? Ma'am. Yo, you're going to cry and refuse the assignment? Yo, I'm not even gonna lie. That was funny. Don't. That ain't even an answer choice. What the? I say A. If it said remove the clothing. This is tricky. Indeed it is. Because you would think like, man, this looks like it's kind of easy, but maybe not. Decon the wound. Okay. I hate these when I was in nursing school. Well, good thing you ain't in nursing school, huh? Now you can just hate these as a nurse. Because I hate them as a nurse too. Physiological first says, is it Alicia? I'm going to say Alicia. I think that's her name. Boy, give us the answer. First of all, ma'am, you don't come up in here and tell me what to do. I tell you what to do. And I'm about to give you this answer as I read this chat, because I ain't just here for you. Who said that? Yeah, you know who you are. Which answer correct? All right, cool. I'm about to give y'all I'm giving y'all the answer because I want to give you the answer, not because you're telling me to give you the answer. All right, here's the answer. Oh, y'all ready for it? Here we go. In 3, 2, 1. It's B. Decontaminate the open wound on the client's thigh. Decontaminating an open wound is the first priority for this client. This minimizes the absorption of radiation in the client's body. The radiological accident is an event that involves the release of potentially dangerous radioactive material into the environment. This release is usually in the form of a cloud or a plume and could affect the health and safety of anyone in its path. So what's a really big one that happened recently? It was the Fukushima. What was it? Fukushima, the nuclear power plant, Fukushima in Japan in 2011. So there were people that were, there was an earthquake that happened. A tsunami literally was like hundreds of feet high and like went into the reactor, shut the reactor down, and then shit got real. And so this is actually one of those types of things that affected, like radiation was spread like all over the world. Like it was fucking crazy. So think about it in that regard. When you think about like any type of like radiological attack. And when it comes to learning these questions, try to correlate them with things that like that help you remember. I'll give you an example. Anybody ever seen Family Guy? So if anybody's ever seen Family Guy, like the one time I remembered the word prophylactic, right? Prophylactic means like to guard or, protect or whatever. Mostly like condoms. Condoms is a prophylactic. The first time I ever heard the word prophylactic was on Family Guy. And so when I hear the word prophylactic, it makes me think of that. And I know exactly what it is because he was essentially talking about how Homegirl was an accident because the condom broke. I'm just saying. It says all the answers are right, but you have to pick the best one. Makes no sense sometimes. No decon can put so many lives at risk. Hey man, I don't write the questions. However, these are some of those, and you also got to think that they'll have questions that are like this, that are research questions in your exam as well. But then also, hey, some of these questions that's just the way that they are. Good luck, everyone. NCLEX is definitely hard, but you got this. Everybody got this. You remember that 73? Correct. You would want to try to save the leg before anything. Why is it not A? It said okay. So A says getting radioactive material off the body as soon as possible can lower a worker's radiation dose from external contamination. Removing outer clothes and showering, or at the minimum, washing the face, hands, and other exposed areas is essential during the decontamination phase, right? But it says, what do you do first? It says, what do you do first? That's the issue. What do you do first? I take the NCLEX tomorrow. I'm scared. Kenya, first of all, I don't need for you to be here. Like, you shouldn't even be looking at this. And I'm being completely honest. Because I'm telling you right now, I'm gonna tell you just like what my instructor used to say to me, that if you don't know it by now, you don't know it at all. I know very well, I have just a really good hunch that you've been studying the way that you should be studying, and you won't have a problem taking your NCLEX tomorrow. You're well prepared. So honestly, what you should be doing is just relaxing, trying to relax and trying not to be nervous. That's better said than done, right? So I would recommend getting off here and then coming back here on Friday on Friday and telling us that you passed. I would rather you sit there and clear your mind and honestly relax. I'm being completely honest with you. Don't drink though. Don't go out there and drink, because obviously, some people do it. I wouldn't recommend it, but you got this. You got this. Yep. Tell us Friday, King. Tell us Friday that you passed. Yeah, you definitely getting lectured. What you think this is? You think you exempt? Shh. Y'all better let her know. All 90 of y'all better let her know. Hey, shout out to all 90 of y'all hanging out with me. Hey, we're going over NCLEX style questions. I am your humble host, Kevin. I go by the Boot Nurse on all social media platforms. Shout out to all y'all. I got 19,000 likes. I don't know why I only got 100,000 likes. Is that even a word? Is that a number? Whatever. Anyways, I appreciate that. Misha said, you love it here? Hey, shout out to you, Misha. I love you being here. Hey, what is that? Did I just get a heart? Mama G. Look. We appreciate that. We appreciate that. Humble and funny host. Look, I try to be as humble as possible because I know, I remember, I know where I came from. I know how hard I struggle with this. And this is exactly why I do it. Okay, I will. Thank y'all. I'll be back with the good news. You damn right you will be. Just say it. You will pass NCLEX and you will be a nurse. We speak things into existence around here. That's what we do. Okay? Speak things into existence and it shall be so. All right, I already passed and I'm just hanging out. It says, I already passed. I just like hanging out here. Look, old man, you can hang out as much as you want. You can hang out as much as you want. Right? Positive talk all day. Facts. Positive talks all day. All right, now, who is that? Now go away. Go away, Kenya. Go away. All right, y'all. Here's our last one. Here's our last question of the night. The nurse is caring for 4 clients and is preparing to do his initial rounds. Which client should the nurse see first, or should the nurse assess first? A client with diabetes being discharged today. A 35-year-old male with tracheostomy and copious secretions. A teenager scheduled for physical therapy this morning, or a 78-year-old female client with a pressure ulcer that needs dressing change. B. Okay, y'all say B. B, 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 B. A is stable. Yep. Okay. B. 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 C. We got B for sure. Okay. B. B, possible obstruction. Okay, Jess the mess. Why do I keep doing that? I don't even know why. What are we doing out here? Emerald says D. AC is no. You're saying A and C is no. 73? User 73? Bless says B. It's accurate. Look, ma'am, I don't know if you are a mess, but if it's accurate, hey, okay. Look, hey, user 73, hey, you're saying yes with a question mark. I don't know. I'm asking you. I would go in the order of B, then D, then C, then A. Calliope, you only pick one. You can't do that. You pick one. B is the right answer. Lindsay, you gonna die on that hill? You gonna die on that hill? You sure about that? You sure? You sure about that? That's can wait. Okay, Misha said that. Misha said that old lady can wait. Very confident about B. Wish all answers were like this. Well, they're not. They're not all like this. We are going with B. I already said B. Oh, okay. I didn't see that. All right, Lindsay, I see you. B, 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 R-I-P. Okay. I see you. Wait, what does that say? It says we definitely dying on that. Okay. All right, cool. All right. Real life ain't like that either. Okay. Yeah, it's facts. It's really not. All right. So here's our answer. Hold on a second. All right, here we go. So the answer is, no, I'm just playing. All right, here we go. So our answer is B, a 35-year-old male with tracheostomy and copious secretions. Yes, it's airway. Yes. So where is it? It said the patient with an airway problem should be given the highest priority. The ABCs identifies the airway, breathing, and cardiovascular status of the patient as the highest of all priorities in this sequential order. So yes, the answer is B. All Kev do is play. First of all, don't come for me. Don't do it. Don't do it. Oh my God. Hey, but you want to know what's crazy though? Is that, as you're right, I do play a lot, but I can guarantee you that when y'all go and study for these exams, whoever's taking this NCLEX, you're going to remember some of these things. You're going to remember them. I'm going to go check on Pops with his trach. Okay. Do some care and then slap what on it? What? Thank you, Kev. When is the next time? Wednesday? Ma'am, Sandy, hospice nurse. You know it is. You know it's Wednesday at 5:30. What are you standing your phone on today? Because happy it's not sideways anymore. Look, Calliope, I just want to let you know, y'all thought y'all were struggling because you said you had to turn sideways. I had to turn sideways to read all these comments as they were coming through, thinking that it was normal. And I had to hold it like this. So you're welcome. I have it set up on like a phone stand. So, Kev, I enjoyed this. Hope we meet again. Absolutely, Miss Just the Miss. Wednesday, 5:30. Hey, this is where I'm at. What it says, anyone who is new in nursing school should read the ATI strategy guidebook. You know what? Yeah. If you like ATI and if you like that strategy book, for sure. Me personally, I don't like ATI, but then you can't put a book in front of me because I'll fall asleep. But that's just me though. So far from trying to be a nurse, but this is all widely interesting. Is it Sienna? It's Sienna, right? Is that how you say it? It is interesting, isn't it? It's just like it's interesting, and she's crying, and she's just like, oh no, like I do not want to be a nurse at all. Also, UWorld was amazing, kind of pricey, but great. I personally don't like UWorld because it doesn't give you NCLEX style. It doesn't give you content. And me personally, and this is a very biased opinion of mine. There's no shade on you, Nicole, for sure. I've used UWorld. I didn't like it. NCLEX High Yield podcast is good. I didn't like it because it didn't provide the content. I had a very big content gap. And I always recommend, even if you feel like you don't need it, it's good to have it. So if you could find a review that has content and Q&A, you'd be solid. That's one reason I like Archer. Another reason why I liked Mark Clemick. A great reason why I liked, why I love Kaplan. Like I love people like Kaplan. I want to say is like at the premium level because I think theirs is like $450 for like 4 months or 6 months, or I can't remember exactly what it was, but they gave you everything under the sun. And Kaplan and Mark Clemick especially were like huge motivations for me to create my NCLEX course because I learned a lot from them. And I know that I have a different teaching technique to where I'm just like, you know what, cool. I want to show everybody how I learned, but then the way that I'm able to retain, if that makes sense. So I don't care for ATI. It has helped me to understand, but it helped me understand what kind of questions. Okay, I got you. I'm tracking. Shout out to all 70 of y'all that are still following me. I think that was all the questions for today. Y'all got me to 21,400 likes. Shout out to y'all. Honestly, this is the most likes I've had since I've done TikTok. And I want to say, Nelly, how many people did we have? Was it like up to like 300 or over 300 people that were viewing the live? That's the most I think I've ever had. Like, and I love it because like once you dust the cobwebs off, this right here, we Gucci out here. Cause once I get to talking and I get to lecturing and I get to, showing, the different ways of how to understand the question, I can't be stopped. I'm just saying. And I love every bit of it. So I appreciate you, Nelly. I appreciate you. Shout out to Nurse Cass and the love, I took my NCLEX when it was on paper and pencil. Lord have mercy. That must have been like in 94 or like 89. I was born in 87. I don't know how that makes you feel, user 89. I'm just letting you know what's up. 93? Yeah, 93, 94. 83? Good God. I don't mean that. Hey, you ever seen that sketch with Kevin Hart where he was like, damn. And he did that to Don Cheadle. And he's like, I'm sorry. Oh my God. I didn't mean it like that. I was born in 83. Ooh. Isabella. My bad. I'm sorry. I didn't mean that. I didn't mean no disrespect. 2001, take my NCLEX in June. Well, you took your NCLEX in 2001? What? 40-year nurse and then NP. Shout out to you. What kind of NP are you? User 89. Everybody can. Oh, Lord have mercy. Hey, if you guys hear my son in there crying, don't mind it. He's just being a turd. He's doing his thing. Hey, I really don't understand like what's up with this lighting. I ain't even gonna lie to you because I look bright. So I'm pretty sure for people that jumped up in here, they're just now finally seeing my face. Yeah, I guess I have the Jason Derulo complex, whatever. I'm that dude, you know what I'm saying? So you're a family nurse practitioner? Okay, cool. Shout out. I don't even know why he's crying, y'all. I don't know why he's crying. I'm about to go figure out why. So, but I think it's just being, he wants to go hang out with his brother. That's what he do. Oh my God, you do what? Brenda, stop. Jason Derulo. Hey, do you know that he actually just had to get a ring cut off his finger because it was swollen? Now you do. I want to get my DNP in women's health. All right, Calliope, go do your thing. What's stopping you from doing it? Go do your thing. What's stopping you from doing it? I'm just saying. So, hey, shout out to, man, I got 75 people up in here. I'm going to hang out for about another 10 minutes. Cass, don't do that. You don't act like you didn't know that already. Stop it. Yes, you do look like Jason. Oh, okay. All right. Okay. It's even worse when I get a haircut. Then people are just like, oh. Oh, okay. Okay. So I'm just saying, y'all are funny. Y'all are funny. I appreciate everybody stopping by. I think I'm just gonna get off now because hey, your boy got to go record some videos. He got to get them edited. He got to get them up on his site because we got people that need it that are taking out their NCLEX. So never stop learning. Got my MP at 55. Hey, let them know. My new favorite TikTok for real. Hey, shout out to you, Calliope. I'm trying to just do my thing. Yep. Aubrey asked me what Jason was talking about on live tonight. Really? She's lucky. She's lucky. I know who she is. But yeah, like your age has nothing. Your age has nothing to do with it, y'all. It has not. I've heard people come in. They're like, "Hey, I'm 40. Do you think it's too late to go back to nursing school?" And I'm just like, I feel like you just wanted somebody to justify you not going. Like you wanted some type of a reassurance. Your age has nothing to do with you going to nursing school, y'all. It has nothing to do with you. It has nothing to do with it at all. Go take care of our TikTok baby and love on. Bye. But I'm about to get off right now. But yeah, your age. Thank you for this review. You're welcome. Not a problem. We'll do it again on Wednesday. I may not do it every TikTok, but I'll definitely try to do it like once a week or so like that. Have you told your nursing school journey or my nursing story before? I have told my nursing story before. I just became a nurse at 45. Look at you, 45 and 5'10". Wow, you're tall. But shout out to you to becoming a nurse. Shout out to you. Calliope, I tell my story all the time. So maybe I'll tell it again. I'll probably wait to do it again. Like when we do I'll wait till we have a whole bunch of people in here so they can hear the story. And then, I'll tell it. I'll tell it while we're doing the questions, like in between something. So 5'10". Shout out to you. He's proud of his story. Did you see that smile? Look, I'm trying to tell you, everybody's journey is going to be different yet similar, and I like telling mine because while some people are just like, oh, that's it. I mean, you didn't have to walk it, just like I don't have to walk yours. It's 42 old to be a nurse. Jesse, did you really just come in here and ask me that? Did you just come in here and ask me that because I was just talking about that? Maybe I should do nursing. I'm 30. Do it. What's stopping you? Resume Bay. Oh, I like that. I like that name. Okay. Resume Bay. Resume Bay. That should be a rap song. Don't ask me to rap it because that ain't it. Unless it's like me already rapping to somebody else's song. You know what I'm saying? So, but yeah, it said, who said this? Isabel says, I have spina bifida and walk with a limp. When I became a nurse, anyone can do it. That's dedicated. That's facts. That's facts. And you have a physical disability, right? So you just got here, Jesse. Look, you gotta get here at 5:30, baby. You gotta get here at 5:30. No, I'm not Haitian, but you gotta get here at 5:30 when we start rocking. That way you can hear the story. That way you can hear everything that's going on. So, but what other question you guys got? What other questions you guys got? I am going to fired. What other question you guys got? Drop them down there. I'm about to get off here. I kind of want to just, kind of touch base with some stuff. Thank you. I enjoyed it. I'm glad. I appreciate you being here. Tipsy B. I don't know why I keep emphasizing people's stuff. Tips for study for the exit HESI. The exit exam. Your exit exam is essentially the accumulation of what you've done for your entire school. The biggest thing the exit exam is preparing you for is NCLEX. So I would definitely look into keep doing. I don't know what book you have, but I know for our exit HESI, it was the HESI book or the Saunders book. And so whatever book they provide you, I would definitely look at that. Can I send you a small about my journey? I am interested in what you think. Is it Nurse Stacy or Stussy? I mean, if you want to, you can. Sure. It's about how many times taken. If I could DM you, yeah, you could DM me. We had the Saunders book. When is your tutoring for students? I meant message you. Yeah, for sure. My tutoring for students. If you go to thebootnurse.com and then you go to the NCLEX Coaching and Mentoring, my tutoring is on a one-on-one basis. So it's just a one-on-one with me. I'm working on doing group coaching, and group coaching it's tentatively going to be every Sunday. and it's only going to be with a group of 5 people. But then, of course, that will be up on my website, and you can go and check that out as well. For anybody that's interested in doing like one-on-one coaching or mentoring, or you need help with whatever. But I appreciate all your questions. I appreciate everybody that hung out here. I'll do my last little plug for myself. I don't see it. What are you talking about? I don't see it on here on TikTok. What are you talking about? What are you talking about? Is it Stacy or nurses to? I don't know. I'm just gonna say Stacy. That's what it looks like. To message you, it should be somewhere on there to message me, or you can go to Instagram. It's my same handle is the same on Instagram. It's the Boot Nurse. So with that being said, I appreciate all of you guys' questions again. I appreciate everybody coming to hang out with me. Like I said, my name's Kevin. I go by the Boot Nurse on all social media platforms. So Instagram, of course, TikTok, X, and all the other ones, to include YouTube. So go check out my YouTube channel as well. And also, if you're a brand new nurse about to start nursing school and you want to get a jump start on an NCLEX program, check out the 7-day NCLEX course. That link is in my bio. You just click the link and it'll take you there. And or if it says, hey, I'm taking you off this page, cool. It's not spam or anything wild like that. It's just taking you to my website. So it's for $48. It's 80% off of the current price. And once you get it forever. I'm just being completely honest. And one other thing is that it is in the pre-launch phase. It is in the pre-launch phase of the program, which means I am consistently adding things to it, recording videos, working on NCLEX style videos right now, especially new generation, as well as working on collaborating with people to get NCLEX style questions. So you definitely want to be a part of the movement. I definitely love having everybody there that is a part of the movement. So you will be an integral part of getting everything. And then when I start adding stuff, the people that are early adopters to it, they get it. So I have a cheat sheet that I'm working on right now. And so everybody that's a part of the program gets it, So, and then, there's other things that are coming as well. So definitely love the fact that everybody's a part of that. But, that's my last little plug for myself, of course, here on my own TikTok. Before I leave, one thing I'll tell all 37 of y'all that are hanging out is no matter how difficult this journey is of becoming a nurse or going to getting your NCLEX or even becoming a nurse, working as a nurse, be kind to yourself. All right. The worst thing, like you not doing well at work or you not doing well on this exam or doing well in school, is I ask you, is that the worst thing that could happen to you? Right. And it's not. And I always reference this as like, you could be in Ukraine right now. You could be maybe not necessarily fighting the war, but you could live there, or you could be in the surrounding countries, or you could be doing, other things and having to deal with the things like that. Okay. Or you could be in a third world country, not, living up to the lap of luxury of what it's like to live here in the United States. If you're here in the United States, because, people are from all around the world. Right. So be kind to yourself. You only got one you. All right. So with that, I am signing off, and I will see everybody on Wednesday, 5:30 Central Standard Time, Texas time. Make it happen. I appreciate all 36 y'all are so rocking with me. And I will see you guys on Wednesday, like I already said. Bye. If my stuff wants to work, bye.